just a lot of items that we need to cover this morning.
You're live.
Okay.
You're live, Commissioner.
Okay. Thank you. Good morning. You're tuning in to the Board of County Commissioners Agenda Setting Work Session. It is Tuesday, February 1, 2022. It is 9:03 a.m. This meeting is set to go until 1 p.m. For public attendance, you may follow along on the Thurston County YouTube channel or join by calling the number 360-252-9020, PIN 1234. I am Carolina Mejia, Chair of the Board. Joining us via Zoom today is Vice Chair Ty Menser, as well as Commissioner Gary Edwards. In the boardroom is County Manager Ramiro Chavez, as well as many other staff who are joining us via Zoom. Today we'll start with our COVID-19 update.
Good morning, Commissioners. Kurt Harden, Interim Director of Public Health. As of today, I want to report, I'm giving is on date 7/27. The Washington State cases for positive COVID cases are 1,339,743. And the Washington State deaths are 10,776 since the start of the pandemic. For Thurston County, our total case count is 42,684. And over the last 7 days, that case count was 2,807. And then our Thurston County deaths are 312. And then our 14-day rolling rate of 14-day average case count per 100,000 is 2,796.9. And I will tell you that last week that number was 2,714.8. Our hospitalizations year to date are 1,781. And then currently COVID patients in our hospitals are 93. I want to iterate that last week they were 82, but 2 weeks ago it was 114. So it's too soon to be able to tell a trend in any direction based on hospitalizations. The number of patients on ventilators is 16, and our ICU availability capacity, we have 5 rooms being reported that are airborne infection isolation room capable. We have 1 non-airborne isolation infection room capable in our ICUs, and then our acute bed availability are 2 AIIRs and 6 non-AIIRs. Our congregate care outbreaks, year to date, we've had 170 congregate care outbreaks since March of 2020. Currently, we have 57 congregate care outbreaks that are under investigation. Our vaccinations numbers, total doses given in Thurston County to date is 491,250. Those people initiating vaccination in the county are 70.7%. People who are fully vaccinated in the county are 63.7%. And then people initiating vaccination 5 years and older are 74.7%. And people fully vaccinated age 5 and older are 67.4%. Additionally, we continue to do vaccinations at the Capitol Mall 7 days a week at our clinic there. And then this Saturday on February 5th at the Tenino Quarry House, we'll be having a vaccination clinic as well. For testing, we continue to utilize the fairgrounds this week for testing on Mondays and Fridays. And then today we're testing in Rochester from 10 a.m. to 1 p.m. at the roof parking lot next to the Boys and Girls Club. Tomorrow in the city of Yelm, we'll be testing from 10 to 1, and the location is 301 2nd Street Southeast. And then on Thursday in Tenino, we'll be testing from 10 to 1 at Tenino Quarry House. Other than that, I will turn it over to Dr. Abdulmalik for her update.
Good morning, Commissioners. We are starting to see a downtrend in COVID-19 case counts that Director Harden mentioned. So that's heartening. We are still watching carefully the transmission patterns with regard to the BA.2 variant. We've seen so we've been watching Denmark, which has a large, for which the BA.2 variant accounts for a significant portion of their transmission, and their cases are rising. And for other countries, some of we're still looking at what that BA.2 variant may mean in terms of what our transmission patterns look like in terms of in terms of rate of decline or other transmission patterns. It's too early. So the CDC is looking at the potential for increased transmissibility of this new variant, but we haven't. But a full determination on that hasn't come out yet. We are not seeing we aren't seeing a safety signal. So we're still learning a lot about disease severity and impact on deaths. However, the good news is that we aren't seeing a significant signal in that regard from, in countries where this is an increasing proportion of virus transmission. So that's good news, but it's still, as we look forward, in terms of what our case counts might do, this is definitely something that we're watching closely. We are very heartened about the overall downtrend. The other piece that I wanted to just bring to folks' attention is that there is increased availability of at-home tests. So covidtest.gov to participate in the federal program, and Say Yes COVID Home Test for the state program. As of this morning, there were still tests left for folks that wanted to participate in that program, which entails folks getting free COVID tests shipped to their households. So it's really heartening that we have increased testing availability, but we should also note that at-home COVID tests aren't reported as part of these case counts. So the case counts that we report are tests that are performed either by a laboratory or by an entity that has a CLIA waiver, which is a certification piece that that ensures that the person performing the test, is performing it properly and that it gets reported. So at-home tests get reported separately or get noted separately as suspect cases. Although we do investigate those cases as well when they're reported to us. So we're looking. In terms of looking at where our county is in terms of transmission, there are multiple different pieces to it. One is, where and how folks are getting tested, as well as that reporting piece. We're looking at this new variant that may be more, the new Omicron variant, which may be more transmissible. And then of course, we're looking at, there's a whole lot of other pieces that are, weather dependent, and in terms of how folks come together and gather, and the protections that folks take in terms of upgrading masks, staying home when sick, and getting tested, that all factor into our transmission curves. And with that, I'm happy to open it up for any questions any of you may have. Thank you.
Thank you, Kurt. Thank you, Dr. A. Questions, Commissioner Edwards?
Yes, Dr. A, this new variant, what's the rate of hospitalization with this variant versus the previous variant, the Omicron, I guess, Omicron?
Yeah, so the new variant is an Omicron subvariant. We're still looking at if there is a potential difference in hospitalizations. And I would say that the fact that that scientists are still looking at it is good news, because that means that the difference is not stark. But we are still learning more about the specific difference between this Omicron subvariant and the dominant Omicron variant in terms of hospitalizations.
And then the symptoms of this new compared to this other one.
So, you know, honestly, in terms of symptom profile, we haven't heard reports of different symptoms with this new subvariant. So just to reiterate for folks, we're still seeing, you know, a lot of headaches, sore throats, nasal congestion, sinus congestion, in addition to, you know, to cough and fever, you know, that we've seen with previous variants. You know, other symptoms that have been present with past variants still also occur. That includes, you know, shortness of breath, chest pain, and then some of the GI symptoms as well. But GI symptoms are a little bit less common.
On the Omicron variant, what's the hospitalization on that? I mean, are they similar to Delta, or is it way less?
So the hospitalization rate overall for Omicron is lower than the hospitalization rate for Delta. You know, our healthcare capacity has been strained for a couple of reasons. One is just the sheer number of folks that have gotten Omicron. Is many more than had gotten the Delta variant. The other piece is that because Omicron is more transmissible, there have been, you know, in addition to other factors, there have been some staffing challenges and shortages as well. So while the hospitalization risk for individuals is lower for Omicron than Delta, the Omicron wave has still had a significant impact on our healthcare system.
Over at the fairgrounds, when you're doing testing, is that a 3-day turnaround on the test or 20 minutes?
So the testing that we do at the fairgrounds is PCR testing. So it goes to the lab. It would be, I think what we were hearing is about a 3 to 5 day turnaround on PCR tests, because it has to do with the number of tests that the lab is processing at the same time.
Okay, and then my final question, out of the 93 that are hospitalized today because of COVID-19, how many are hospitalized because of COVID-19, they were brought in, or they came in with a broken leg and they were tested positive, so they have to keep them isolated from others?
That's definitely a question that we ask our teams when we meet with them, and I will say that the answers that I received definitely vary by patient pool. You're right, there is a proportion of folks that test positive as part of routine screening, exactly for the purpose of isolation, and we still have folks that are coming into the hospital because of complications related to COVID-19 illness. We can reach out to our healthcare partners and get a sense of where we're at in terms of at this particular point in time and get back to you.
Thank you.
Thank you, Commissioner Edwards. Commissioner Menser, questions?
Yes. If we assume that the Omicron or BA.2 is kind of where things are going to stay. So assuming we don't have a new, more deadly variant that arises, and this is kind of where this is the virus that's circulating, is hospital and capacity and staffing, is that the thing now that would be the gatekeeper towards, you know, would we see, if that starts to fall because cases fall, would we then see recommendations from CDC or whatever that would change masking and distancing and all of that requirement? Or is that, or are there other things that kind of weave into that? Just curious.
Yeah, so that's a complex question, and it's one that we're talking about, you know, a lot with our colleagues. So hospital capacity is one piece. And I guess the other pieces that we're looking at are COVID-related deaths. That's the second piece. So that disease severity piece is a part of it. And then it's looking at so it's looking at risk factors for severe illness. So thinking about where are folks, if they get COVID, most likely to have severe disease, or where is it that folks, if they get COVID, are more likely to spread it rapidly to others and cause outbreaks. So in terms of things that we're thinking about are, as we move forward, the response really focuses always on where we can do the most good. So where are those high risk settings where transmission is a very high risk, where if one person gets it, you're gonna, many other people are gonna get it. Where are those settings where if somebody gets it, the other folks who are at risk are at high risk of severe disease? And then as well as thinking about our hospital capacity, and then of course COVID-related deaths. So there's multiple pieces that play into it. What we're looking at is right now we're still in a pandemic mode where we're seeing dramatic changes, rapid rise in cases and dramatic changes that way. We are anticipating, along with many scientists, that COVID-19 will likely become endemic, which would mean a kind of a steady state of infections in our population. We're not there yet, but that's what we anticipate. That's what we anticipate happening, because of the new variants, because of many different factors. It's hard to tell what that timeline is going to look like for us here in Washington and here in Thurston.
Okay, thank you.
Okay, thank you, Kurt. Thank you, Dr. A. I don't have questions.
Madam Chair,
Yes, sir.
could I just get a couple of quick follow-ups here?
Okay.
Where are we at on the natural immunity recognition versus getting the vaccination when it comes to, I don't know, the mandate, and maybe getting hospital workers back into work if they've had it, versus they still didn't want to get a shot, but it's obvious now that the natural immunity is much more effective than the man-made vaccination. So anything new on that front?
So so vaccination, definitely has a specific definition, and it's the safest way to promote immunity from COVID-19. When folks contract the illness, there is a lot of variability, and there's that risk of severe illness and death. We continue to looking at antibody levels. We continue to count, folks who are exposed to COVID-19 within 90 days of a test confirmed COVID-19 infection. We do continue to count them as protected unless they develop symptoms. So that data is fairly robust. Additionally, a lot of the data that when we look at it in terms of natural infection and vaccine, the data that actually recently got shared is that the people with is that the folks that both were vaccinated and had an infection with COVID-19 were well protected. Was that data piece? And we know that folks who have been vaccinated and have had COVID-19 before are much better protected against reinfection than folks that just were infected and didn't receive vaccination as well. So in terms of the mandates, that's definitely more of an executive branch decision. But in terms of the data, I agree that we're learning a lot about that nuance. But the vaccines are safe, they are effective, and they protect people even if they've already had a COVID-19 infection.
I'm not advocating that they go out and get, the COVID instead of the vaccine, but at some point we need to recognize if the science is there showing that there is this protection and get these people back in our workforce or whatever it's going to take. And you mentioned the executive session, our position. I suppose that means the governor's office. How about from the State Department of Health? Don't you guys stay in touch? And hey, looks like within a week or whatever, we can get away from this mandate, start bringing these people back to work, and somebody's got to have a little better understanding of this.
Yeah, thank you, Commissioner. I don't have additional information on the mandates at this point in time, but thank you.
Okay, thank you.
Commissioner Edwards, I was going to add to that. We are in contact with the Department of Health on a daily basis. However, we have not been consulted or heard of any information regarding a change in the mandates at this point in time.
Okay, thank you.
Commissioner Menzer?
Yeah, Commissioner Edwards just stated that it's obvious that protection from infection is much more effective than protection from the vaccine. I have not heard that. Is that true?
So no, what we're learning is that it's the protection from previous infection is actually is that it's nuanced. So there are a lot of different pieces that we know. So we know that that the vaccines, protect against severe illness and death, as well as especially if folks have had a booster dose, it's protective against. It's very protective against symptomatic infection, although that protection has varied as we've had more variants. In terms of some of the data that the CDC has released, is that during the Delta wave, the people who've had both vaccine and a prior infection also saw a bump in their immune protection against COVID-19. And we also know that folks that have both vaccination and a past infection are much better protected against future infection than those that had than folks that had past infection alone. So there's a lot of different pieces that we're still learning, and then Omicron itself throws adds another level of complexity because we have seen an increase in reinfection rates with Omicron because it's different. Then it's fairly different from past variants, as well as so our in terms of the impact of Omicron. The impact of past infection on Omicron is something that we're still learning about. A lot of what we're looking at now is through the retrospectoscope, looking at the protective, at how protective past infection is kind of in the Delta wave. So the Omicron wave is still fairly new, and so that data is still being parsed through. But I just want to say that the safest protection folks can have is from vaccine. And I would just add that Moderna yesterday received full FDA approval for their vaccine for 18 and up, joining Pfizer. So it's no longer emergency use authorization. And I would and that folks that natural infection has a lot of uncertainty with it in a way that vaccines don't. So there's the variability in terms of folks' immune response. So there's some folks that may become infected and are still don't have that lasting immune protection. So there are a lot of variables there. And then of course there's that disease severity, long COVID risk piece that's also associated with natural infection.
Okay.
Thank you. Okay, on to item number 2, homeless strategies. And I see Keely.
Good morning, Commissioners. Keely Marino with Public Health and Social Services, Homeless Coordinator. With some few updates for you today, starting off as per usual with our rental assistance program update. Community Youth Services serving residents of Thurston County between the ages of 18 and 24 have served 187 households, and there are 284 of those households in progress, meaning actively working with a case manager and getting rental assistance on board. And they've spent approximately $1.4 million in rental assistance. Moving on to Community Action Council, serving the rest of citizens of Thurston County that need help. They have, up to this date, served 3,745 Thurston County households, spending $26 million in rental assistance and about $1.2 million in utility assistance. One thing that's important to note, that at this rate in which they are spending rental assistance dollars, CAC has about 6 weeks remaining of that funding, and that is about all they have. We do anticipate the Department of Commerce to be providing more funding for rental assistance. However, there may be a gap. So it's important to know that, and we'll keep you updated about what that might look like as time moves on. We are currently in the process of drafting an interlocal agreement with the City of Olympia, just beginning those negotiations around the home fund, which was passed last week. And then we continue to support residents that were displaced from the Deschutes encampment at 2 hotels in the Olympia and Lacey area. We continue to meet with staff from Lacey, Olympia, and service providers supporting those individuals on a weekly basis, several times per week. And I did hear some good news that the Olympic Health and Recovery Services, which is connected to law enforcement assisted diversion program here in Thurston County, has 29 individuals that have expressed interest or enrolled in substance abuse treatment program through LEAD. And that particular program is also attached to housing funding. So as beds become available and individuals are still interested and ready to go, then those folks will go into treatment and then have a case manager helping them get into housing following that. So that's super exciting news. And that's all I have for you this morning.
Commissioner Edwards, questions?
Well, I noticed the start of the junkyard hasn't changed any out on 101 on the exit to the courthouse. So just wondering if there's anything new there.
Tom Webster, the program manager for our office, has reached out again to get some just response from Department of Transportation, and we continue to wait for that response. So as soon as we hear anything, you will be the first to know.
Thank you.
Commissioner Munster?
This may be something that you can't answer, Keely, so feel free to let me know that. But I'm curious about the discussions regarding rental assistance, kind of like what's the arguments about the kind of the trajectory of it in a sense, because, at the beginning we had 25% of our local businesses shuttered, and we had 1,400, I remember, unemployment claims in that first month. It was an incredible, unprecedented spike. And I'm just wondering, now that we're kind of 2 years down the road, businesses are not restrained from operating. What is the argument that we need to continue rent assistance? I mean, there's always people in need, right? There always was people in need, and there always will be probably. But in terms of this particular program that was COVID driven, what's the thought behind when it should end, why it should end, whether it should end, all that?
Well, some of that is determined by legislation, and this type of program is what would be considered in the terms of art of homeless response prevention. So prevention has been underfunded in previous years, previous to COVID. So for instance, the House Bill 1277 has some requirements. Some of those funds are used for rental assistance. In that spirit of prevention is going to continue to be a need with such high rents that we have in experience here in Thurston County and across Washington State. It's becoming incredibly difficult to find affordable rental housing. So as I don't see any numbers pointing that trend will reverse, rather it's anticipated the growth in our region is going to continue, which ultimately means a continued rise in rents. So I think that it will be a continued need. It may be on a smaller scale, but I know that it's a focus at the legislature this year. Again.
Okay, and we've had, I think you kind of alluded to this, we've had some stream of money that was geared toward rapid rehousing and rental, I forget the term, but the prevention of, that it just wasn't at this scale. So
yeah, I would say that with rental assistance, there's been very little funding until COVID. Rapid rehousing, yes, which is a different program than rental assistance. So this is all new, but it's definitely been something that has been arguably missing from homeless response.
Madam Chair,
Yes, sir.
I'd like to ask Keely one more question, please.
Can I ask?
Yeah. Oh, when you're done. When you're done.
And then I'll pass them on to you. Keely, on that topic of rental assistance, I know we're set to get more funding for that. Do you know when that's expected to come? Do we have any timeline on that?
No, I imminently, Tom's on the call as well, but we do not know exactly when that funding will be coming from Commerce.
Okay.
The $1,277 we will theoretically be able to create an RFP for sometime in April. Is that correct, Tom? I think sometime in April, which does include rental assistance dollars in it, but in terms of just rental assistance, it's not clear.
Yeah, good morning, Commissioners. Tom Webster with Public Health and Social Services. Keely is correct. We've heard from Commerce beginning last November that they were going to allocate additional rental assistance resources to the county. We were told those will be coming very soon, but we do not have a date on when we expect those yet. So still waiting for additional guidance from Commerce.
Okay. And then it's exciting to hear that 29 individuals want to go and start using the LEAD program. It's very exciting. And if possible, I would like to hear future updates on that and how that's going. Because I know that was definitely one of a very exciting project when it started. So Commissioner Everts, back to you.
I guess we have no hope of reducing the cost of rental occupancy unless we get adequate housing. And I'm wondering if maybe either you or Tom have been following any of the legislation that is allowing for auxiliary dwelling units to be constructed and to make it a little easier to accomplish that. Are you following any of that you could give us a quick brief on?
I have been following it, but I am not prepared to give a brief on that right now, but I'm glad to do so next week.
Okay, thank you.
Okay, thank you, Keely. Thank you, Tom. With that, we'll move on to review BoCC draft agenda for our meeting on, just kidding. Our meeting on February 1st, 2022 is canceled this afternoon. So there is no agenda for this afternoon. So with that, we will move on to review the BoCC draft agenda for our meeting on February 8th, 2022. That is next Tuesday. Okay. So with that, Ramiro, anything before we start reviewing this?
No, ma'am. Go ahead.
Okay. Okay, so we'll call the meeting to order at 2 p.m. At 2:05, we'll do presentations. So the Pledge of Allegiance to be led by Vice Chair Menser. We'll do the approval of Tuesday, February 8th, 2022 agenda. We'll do the approval of the board meeting minutes from January 25th, 2022. And then we will have a presentation, a proclamation of African American History Month. Ramiro?
Yeah, thank you, Madam Chair, for your consideration. We have a proclamation is circulating for your review. If you have any comments, please let us know. For you to consider to proclaim February 2022 as African American Month here in Thurston County. We're working with staff to see if we can have some guests participating on the Zoom meeting next week. So you will have the opportunity to present that proclamation to the guests as well.
Thank you. Questions, comments, Commissioner Edwards,
No, ma'am.
Commissioner Menzer? No? Okay, on to the next item, opportunity for the public to address the board. Do you know if there's,
I don't have anything at this point, but certainly you will receive some public testimony. Not sure on what yet.
and then county manager's update?
I don't have any specific follow-up to any comments received yet.
Okay. Item, then consent items A through C. 3A from Human Resources is waiver of procurement policies for professional services contract with executive recruiting firm. And I see Maria. Go ahead, County Manager.
Thank you, Commissioner. For your consideration is to waive the bidding requirements based on the Thurston County Procurement Policy 201. And this is to moving forward and securing a firm that will help us on the recruitment for the Public Health and Social Services Director position. This is allowed since it's a professional services for you to consider this waiver. And Maria is going to walk you through a little bit more, but this really is a firm that has good reputation, is the Prodman firm, and this has been successful in having over 550 recruitments in cities and counties, and they're located in Issaquah, Washington. When we began this process late last year, it became a little bit difficult because all those firms are extremely busy. And Maria can attest to the fact when we reach out to some of the firms, either they were declined to have a business with the county because they were so busy, or they just didn't respond to our request for information. So for your consideration, this will allow us to move forward and with this particular firm, so we can start the recruitment of the Director of Public Health and Social Services. Maria?
Good morning, Commissioners and Romero. So I think one of the things I would like to, emphasize is that the Public Health and Social Services Director is key, especially right now with the pandemic response. And they have so many responsibilities for foundational health and, just all of the things you're hearing today. So utilizing a recruiting firm that is experienced and can devote all their time to finding us the right candidates and shepherding the entire process. Recruitments are extremely time sensitive and they're laborious. And so as Romero said, right now with the job market, a lot of these recruiting firms are extremely busy and they're not even taking on additional, but Prothman was responsive. They provided a very detailed timeline. And so today I'm asking for you to waive the bidding requirements and allow me to proceed forward with utilizing the firm. Any questions? Commissioner Menzer?
So I did an intake interview with somebody. Is that somebody connected to this firm or is that something else?
No, yeah, that's correct. We're just doing the groundwork on that. So it was from the same firm, Commissioner. You as the chair of the Board of Health, by the way.
Questions, Commissioner Edwards?
No questions, thank you.
Okay, thank you, Maria.
Good morning and have a great afternoon.
Okay, next item is reappointment to Capital Area Regional Public Facilities District Board.
Yeah, thank you, Commissioner, for your Commissioners, for your considerations to reappoint Chris Leach to the Capital Area Public Facilities District Board as a regional representative, and the term will be from March 1st, 2022 to March 1st, 2026. When you review this item, Commissioner Mejia had a couple of questions related to this particular district. So let me read the purpose of the district, and then I believe the second question was the annual report. And I have some information for you. So the Capital Area Regional Public Facility District is a municipal corporation. It's a special taxing district created by Lacey Olympia Tumwater in Thurston County in 2003. It finances payments on bonds issued by the Lacey and Olympia for construction of two regional event centers. One is the Lacey Regional Athletic Complex, and the other one is the Olympia Hands-On Children's Museum. The district is authorized to receive 0.033% of the state's share of the sales tax generated in the four jurisdictions as allowed for by RCW 82.14.390. This legislation authorized the use of state revenue to promote economic development by supporting the construction of certain public facilities in local jurisdictions. That's the premise of the district itself. They have a few members. One is a regional representatives, one from a representative from Olympia, a representative from Tumwater, and a Thurston County representative, as well as the state treasurer is a representative in this board. And the last question was when the annual report is provided. This particular board meets only once a year. And the last meeting was held on August 25th, 2021. And at that point is when it was the president provided a report. They reviewed the 2019 annual financial elements of the board, and also they provided the 2020 annual financial report, which ended on December 31st, 2020. Since they meet once a year, there will be meetings, I believe, later in 2022, where they will be providing a report of the 2021 year. So that's what I have for you. I believe I addressed your questions, but if I missed anything, please let me know. I can follow up with any additional information.
Questions, Commissioner Edwards?
Yes, what's the rough dollar amount raised by this district annually?
I don't have that, but I can certainly find that for you. Let me look in the financial report, which is right here.
Okay.
So the sales tax revenue in 2020 and 20 is $2,187,423. Well, I got that information for you right off the bat.
Boy, you sure did. And that's, okay, thank you very much.
Commissioner Menser?
No.
Okay. Thank you, Ramiro, for that information. Okay, and I have no opposition in appointing Mr. Chris to the Capital Area Regional Public Facilities District Board. Okay, moving on to the approval of the voucher list. And I'm guessing the amount will be filled in.
Yes,
Later
before the
on.
meeting. Yes, ma'am. If the board members like to look at the report, and then we'll put the number before next week's meeting. Yes.
Questions on that? Commissioner Edwards?
No questions, ma'am.
Commissioner Menser?
No.
Okay. Moving on to department items. Item 4A, set a public hearing regarding operations of the Black Lake Special District.
Yeah, thank you, Commissioner. This is a long conversation the board has had. It's just a matter of background. In, I believe, September 2021, you received a petition by a group of citizens asking the board to hold a public hearing with the intent of, I believe the petition includes the dissolution of the Black Lake Special Use District. You held an executive session related to this matter. As a result of that executive session, you have asked me to bring this item for you to consider. Setting a public hearing for March 8th, 2022 at 3 in the afternoon or soon thereafter, as the matter may be heard in this room, to receive public testimony as a result of filing of application to consider the suspension of operations of the Black Lake Special Use District. In this case, Elizabeth is here, and next week, when this item is becoming part of your consideration, take an action. Elizabeth is going to present the item on our behalf, and that probably will provide additional perspective as to how this came to be individuals related to this particular petition, that this item will be on your agenda for next Tuesday. And I have received responses on that, so at least they are aware of this particular action that you might be taking. That's all I have for you at this one. Do you have any questions?
Questions, Commissioner Edwards?
No, ma'am.
Commissioner Menzer?
No.
Okay, thank you. Moving on to item 5A, Public Health and Social Services, Healthcare Authority Contract Lead Expansion Services.
Yeah, you have items 5A, 5B. You reviewed those items a couple of weeks ago, and at that point, I requested the board to remove from that agenda item since we were not ready with the contracts. Well, we have already worked with the state, and they have already fixed some of the issues, I believe, they have with the contract. So this is ready for you for your consideration. Item 5A. And this is related to the Law Enforcement Assistant Diversion Program. This program was implemented a little over a year ago as a pilot program here in the county, where the program itself allows individuals, they can be diverted and to provide support as a result, reduce the adults, with behavioral health and other issues, avoiding to go to jail and provide the immediate services to those individuals involved within the system. So they would receive a grant last year on the pilot program. This particular item for your consideration is extending with additional money over $1,113,152, and the duration of the contract will go all the way to January 30th, 2023. I have been participating on the lead meetings, and so far the referrals have increased in the last few months, and so far it has been extremely successful. The last number that I received, I believe it was close to 90 referrals that we have gone through this process, and 3/4 of that have been referred by law enforcement here in Thurston County. So with that, Mary Ann.
Thank you, County Manager. That would be correct. And the change to the contract is to make sure that you were aware the Healthcare Authority, we had been asking and they had agreed to, instead of do date of execution as a signature, which is a very common practice for the Healthcare Authority, they had agreed at the last moment. We had been asking for a while to do October of 2021. To have the contract begin at that point in time. And so that was the change we had requested, and then they had agreed to that. And we really appreciate that change. And so it still runs through June 30th, 2023. It just allows us to assure that we get every opportunity to use this funding fully to support the program. So, and as the county manager said, we have had every law enforcement agency who signed up initially to participate refer, and more have signed on to participate. And so referrals have gone very well with others interested in the community to participate. So it's a really good launch, and thank you for your support.
Thank you. Questions, Commissioner Edwards?
Yes, when we started this program, wasn't it initially just for the sheriff's office, and then the plan was to hopefully include everybody? I just don't remember exactly how that fit. And then I was thinking maybe the dollar amount would go up a little more based on everybody playing the game. But that's... Can you kind of elaborate on that? I'm a little mixed up on it, to be honest with you.
Sure. So to answer the first part of your question, we would not have this funding at all had it not been for the Thurston County Sheriff's Office. So just to be clear about that, because of that and the Thurston County prosecuting attorneys and the support from the county commission to participate with public health, that partnership made it possible to even have this opportunity that that law enforcement plus prosecutor plus also the public defense participating in this was a unique aspect of this. So you're correct. The sheriff's office was key to this and was primary to this. However, we did initially have the geographic area as wanting to include this city of Lacey and city of Tumwater. They were very interested in this. I know Commissioner Menzer worked very hard to have discussions with interested members of city of Tumwater. I personally early on received phone calls from members of even fire in Tumwater who were very interested in this coming to Tumwater. So that geographic area we initially wanted to start with was going to be that combination. Then if we had that capacity to add and serve, we would expand. And so what the sheriff's office did, which was very thoughtful of them, is they took two specific areas that connected to those incorporated areas that B and C districts that they operate in that connected to begin working within for this particular program. But since we do social referrals where you can just refer anyone that you as a Thurston County sheriff deputy view as eligible, it doesn't really matter where you're working out of in that unincorporated area. You can refer to lead. So it allowed them to just expand and serve anyone that they felt was eligible. But as we had enough case managers and were able to fill those spots, because Olympic Health and Recovery Services got everyone on board so quickly, like immediately filled the spots. We were then able to get everything in place, and then we're really pleased Yelm is interested. So we were able to also have that opportunity to have some discussions with them about that, and that's kind of in process. So that's where we stand at the moment. And when you talk about the money component, the Healthcare Authority actually did increase some of what they're offering to us. That's included in the amount that you see, to add another case manager. And that case manager, so we will be able to increase by one more case manager through this funding. And that case manager is actually to meet one of our diversity, equity, and inclusion goals for this particular program. And that is, we're seeing a need for bilingual Spanish, a case manager. And so Olympic Health and Recovery Services will be adding that and hiring for that to add to the existing service provision staff that they have. And so we'll be able to meet that need, as well as expand by one more FTE out of this. That will be really helpful for us in reality when we look at sustainability and what we have to offer as we look at the next steps, which are also what are we going to continue to fund? Where are we going to get the money to fund that? Because it's not just going to come out of treatment sales tax or somewhere else. We need to start having those plans and strategies in place for when it becomes 2023. And so those are things that I'm thinking about and talking with others about, so that we can think about what are the best ways to continue forward and what should we continue forward. So I hope that helps. I'm sorry if I missed anything else you needed.
And so you feel this is adequate funding for right now to continue to make it all work, right?
At the moment, I do, because what was able to happen is because you all allowed this to begin when it did, supported it how you did. Olympic Health and Recovery Services through the ASO was able to bring in the Recovery Navigator program. which then added additional capacity in addition to LEAD. So it's not a LEAD program, it's a LEAD-like program. And that added even more services like this to Thurston County. And so we have a LEAD team, adding an FTE, recovery navigator services, which is another element. And then that organization and some others are doing some other work. I wouldn't presume to even say what else we need. So I would just back off on that. Like, there's a lot of other things Thurston County with almost 300,000 people needs at this level, pre-arrest. Crisis related services is an area that I would say we need a lot of work in. LEAD actually is in a crisis program, so I just would say that. But from a LEAD program, the LEAD model in its box of what it's doing, I think we also need to do a check-in this spring though, and find out what law enforcement thinks when we're at about a year, and have some more things in place and do that check-in like we did. The prosecuting attorney's office has been wonderful to work with and do that check-in like they did. They held some special meetings just to make sure, are we doing the fit for them and meeting their needs as well, and keep doing that check-in with them, and if not, adjust. And then if we need to adjust, see how best to adjust. But at the moment, I think we're doing pretty good for the LEAD box of services.
By any chance, sometimes on these type of programs, the state will have an earmarked block of resources to utilize for the program statewide. And then a lot of times there's other jurisdictions maybe that aren't able to get their, I don't know, say get their act together or whatever. So will you be watching that to see if we can't maybe glean more resources to expand our program and even maybe make it better? Is that something that you'll stay on top of?
I would say one of the things I am, I always have my eye out for Thurston County and what we can do around this, and what we can bring in, because technically this is under the opioid response program, what we can bring in, and as a pilot program, if there's additional funding that's available, I have to tell you, we have a really great healthcare authority program manager, and she is really good at watching out for these kind of programs and for those of us in this pilot program to make sure we have as much as she can help us have. So I know she's watching out for us. She wants us to succeed. And I know I have my eye out for that. And our contracting partner has our eye out for us.
Oh.
So yes, I'll be looking as well.
Thank you.
Okay, any further questions, Commissioner Menser?
Whatever question I had, I've long forgot it, so no.
Okay, so hopefully you'll remember for next week. We will review it once more. Okay, and so that concludes item 5A and 5B, and moving on.
Ma'am, the 5B is a little bit different. 5B is related to item 5A, and 5B is to authorize a sign-in with a healthcare authority for us to utilize the Julota case management and data collection system. That is
you connected it last week, and you kind of mentioned
not the couple.
and
Sorry,
we're just going to tackle it.
I apologize for the confusion, but I'm just going to make sure that that is addressed. And this item is $74,080, and that is also covered by the grant, I believe. So, and just going to, it's two items related, 5A and 5B. Thank you, ma'am.
Thank you. Questions on 5B?
No, ma'am.
No. Okay.
This is our third time through this one, so I'm good. Thank you.
Okay. Thank you. Thank you, Marianne. Okay.
You're on mute, man.
Okay, moving on to item 5C. 2022 request for proposals for social services.
Yeah, thank you for your consideration. This is a yearly ask. The staff is requesting for the board, in this case, is to authorize the 2022 request for proposals. The Department of Public Health and Social Services will be soliciting project proposals for funding under the Federal Home Investment Partnership Act, the Affordable Housing Fund, which is the Substitute House Bill 2060, and the Homeless Housing Fund, Substitute House Bill 2163. The applications received under this program will be reviewed by the Regional Housing Council, and those will be provided recommendations for the board to award those contracts. Included in this RFP is also solicit applications for the Veterans Assistance Fund. These applications will be reviewed by the Veterans Advisory Board, and those recommendations will be provided by the Board of County Commissioners for your recommendation to award those contracts. In terms of the dollars and cents, the federal funding for home totals just about $700,000. The CDBG funding totals just about $1 million. And the local funding, which is the Substitute House Bill 2060, is about $500,000. The other Substitute House Bill 2163, approximately $400,000. And the Veterans Fund is about $75,000. For a total potential award of $2,675,000. Tom?
Good morning, Commissioners. That's an excellent summary. I'm happy to answer any questions. Many of these funds we awarded last year, especially for the local document recording fee, the 2163 funds, were 2-year contracts. So this is a smaller RFP for a lot of the affordable housing and homeless services funds than we traditionally or annually award. That is because last year, most of the funds were 2-year awards. So this is a smaller RFP this year, but we do have these funds that we're hoping to put out and happy to answer any questions. I'll just say, sorry, hoping to have the RFP out on February 25th with applications due on April 1st.
Okay, thank you, Tom. Questions, Commissioner Edwards?
No, ma'am.
Commissioner Munzer?
No.
I have no questions either. Thank you, Tom.
Thank you.
Okay, moving on to item 5A, Public Works. Resolution to apply for a grant from the Salmon Recovery Funding Board for an unnamed Dempsey Creek tributary at Shawn Drive Southwest.
Yeah, thank you, Madam Chair. This is an item that is kind of unusual when we apply for an application to get grant funding for projects. In this case, this grant is from the Salmon Recovery Funding Board, which is related to the State Recreation and Conservation Office, the RCO. This particular grant requires a legislative action for us to apply for funding. You have taken similar actions in the past. So this is related to, as you stated, Madam Chair, this is for remove the barrier on a tributary of unnamed tributary on Dempsey Creek. And this particular project is related to the overall fish barrier removal project the board has supported. And I have to give kudos to Public Works because they'll continue to find ways to bring funding to address the fish barrier proposal. This grant request is for $50,000. And Elena Fernandez is here if you want to add additional perspective.
Good morning and thank you. You summarized this very well. So, in order to apply for the grants, we do need a resolution from the board. So it is a grant requirement. And I'm happy to answer any questions.
Questions, Commissioner Edwards?
I'm not sure I need a question answered as much as will we make sure to tell our story in the resolution as we move forward, because we were obviously one of the very first that even started this program well before the court ordered it. So I think that helps us be in line for that funding source to assure it. Anyway, it doesn't hurt to brag a little bit once in a while when we're ahead. Thank you.
Thank you, Commissioner Edwards. I completely agree. I was going to say we do have a link to the Fish Passage Enhancement Program on the Thurston County Public Works website, and it definitely tells our story. It's a very nice story map that was put together by our communications staff. Yeah, you know, if you're interested in that, it definitely tells our story very well.
Thank you.
Thank you. Commissioner Menser?
I guess my question is about how this grant fits in with what we're trying to do at Country Club Road, because I get a lot of community, it seems like that's the culvert that the community is concerned about. I continue to get, just in the last week, I've gotten another series of inquiries about, are we pursuing this funding? Are we pursuing that funding? And so no problem with this project, but I just want to make sure, like, I couldn't remember the details in those conversations about exactly which funding streams we were pursuing and why, you know, I was asked, are we going to this, there was some cutoff for capital projects with the state legislature. I was asked if we get our project onto that request list. And so I guess I'm just wondering, in the grand scheme of all these funding streams and all these fish passage projects, what's the update on Country Club Road culvert, and is it competing for the same dollars as this, or is it something totally different? And are we prioritizing that one highly, because I think that's what the community is expecting right now?
Thank you for your question, Commissioner Menzer. We are pursuing as many funding sources as we can for the Country Club project. We are committed to replace that culvert by 2024 that is outlined in our permit for the emergency repair. We have applied for the Fish Barrier Removal Board funding to fund the design and the alternatives analysis and final design permitting for the Country Club Road culvert. So that definitely is a priority for the department. These particular grant monies tend to be smaller, through the surfboard. So basically what money we can save on some of these other projects that were in the queue prior to the emergency repair is money we can apply to Country Club Road and to that fix.
And one thing, I mean, you said we're committed to replacing it by 2024, but if I recall, we're studying a range of options, one of which would not replace the culvert, would actually remove the road. And I don't know, there were several different pathways that I remember we were still keeping our minds open about.
Correct. We have not at this point committed to one particular fix over another. We're still evaluating the alternatives. So, and yes, that is one alternative that we are evaluating. So I'm not sure when we're set to have that alternatives analysis complete, but it is very soon.
Okay, thanks.
Isn't there a design study being done? Is that where we're at?
Yes, that's the alternatives analysis that I'm referring to.
Okay. Just clarifying. Okay, well, thank you very much. Okay, and I see you are also on the next item. So item 5B. My number is hole punched, so I couldn't really see the number.
Yeah, similar to the
6B.
previous item, Madam Chair, and this is for $80,000 request from the same funding source, and this is to address the Thompson Creek crossing on Thompson Creek Road East. Similar scenario, but in this case is to request $80,000 from the surfboard.
Okay. Questions, Commissioner Edwards?
No, ma'am.
Commissioner Menser?
No.
Okay, thank you very much.
Thank you.
Thank you, Lena.
Okay, so now moving on to our standing items. 7A, Commissioners will report on board work sessions and assigned committee meetings, providing updates on actions taken as well as upcoming issues. Item 7B, the county manager will review the Board of County Commissioners schedule for the week of February 8th, 2022, and 7C, adjournment. And at 3:30, we will have our Board of Health, and that comes with a separate agenda. So it is 10:12. I know we have a longer meeting today. Do we want to go ahead and take a small break now and a small break at 11:30, or would we rather complete the Board of Health and then take a longer break after that?
One question, my packet does not have a Board of Health agenda. Do you guys have a Board of Health agenda?
No, I do not either. I was trying to find it online earlier.
Maybe this will be a good break. We'll send you that via email.
Okay, perfect. Okay, so with that, we'll go ahead and take a 10-minute break.
Yes, thank you.
So we will be back at 10:23. 27 a.m. And we'll pick up where we left off in the review of the BOH draft agenda for our meeting on February 8th, 2022. I'll hand it off to Commissioner Menser.
Thank you, Madam Chair. We are looking at next week's proposed agenda. The meeting would be called to order at 3:30 or thereabouts following the Board of County Commissioners meeting. We will review the agenda and minutes from January 11th, 2022. And then we have two proclamations scheduled. One is a proclamation for American Heart Health Month. And Kurt Harden, our Interim Director of Public Health and Social Services. Kurt, anything we need to know about this proclamation?
Sure. What we'll do, Kurt Harden, Interim Director of Public Health, what's going to happen is I'll be joined by Ben Miller-Todd from Emergency Services and Medic One. He'll be providing some of the numbers and statistics and background. And we may also, we're trying to firm it up, but we may also have some other people who will join us in the healthcare industry that be able to talk a little bit more about that. We anticipate not more than 10 minutes for this presentation.
Commissioners, any questions for Kurt about Heart Health Month?
No questions.
No questions, sir.
Okay. Our next one then will be Children's Dental Health Month. And I see Marianne O'Gara's here. Marianne, do you want to just give us a kind of a thumbnail of what we're going to do on this one?
Thank you very much, Commissioner Menser. We'll be sharing a little bit with you about the importance of children's dental health, and we will be sharing some local data about some of the concerns that we do have, some of the steps that we've been able to take as a community, both prior to the pandemic and during the pandemic, and some opportunities that exist that involve both public policy that you've participated in, some highlights there, and one of our partners that we will be having present with us that is mentioned in the proclamation that has done some amazing work to support children and families. Choice Regional Health Network will be with us, and they're mentioned in the proclamation for the ABCD program, the access to baby and children dentistry. They're doing some changes to expand services that will be a wonderful asset to our community, and they're able to come join us and share just a little bit about what that means to children with special needs in our communities. That's what we're looking to do, and keep it brief but succinct, and share with you some good news.
All right. Any questions for Marianne from the board?
No, sir.
No, sir.
Okay, thank you. All right, well then that'll get us to the opportunity for the public to address the Board of Health, and we will have that opportunity. And then we've got just one department item this month. We had another one proposed that ended up needing to be delayed. So we're down to item 4, which is comprehensive, basically the 1152. E2, I don't know if that's a typo. E2 SHB 1152, comprehensive public health districts. Kurt, why don't you tell us what we're doing with this one?
Sure, that is a typo, and we'll make sure we get that corrected for the final agenda. This is the one that expands the Board of Health under House Bill 1152. I think the county manager has some background on that. I'll turn that over to him for the background, and then I'll lay out a timeline.
Yeah, well, thank you, Kurt. Thank you, Commissioner. Kurt and I are in a tag team next week, and I will provide a little bit of an overview to the benefit of the public what House Bill 1152 does. How the makeup of the new Board of Health should be put in place. And also we'll touch base a little bit on the timelines related to the rulemaking. The Department of Health is in the process to do so. And related to the timeline, the rulemaking versus some of the actions the board needs to take. Hopefully I can address some of those questions and get to the point. And but we have a strategy that will be presented to you next week in terms of specific deliverables and the specific timelines We had the opportunity to go through this with a Deputy Prosecuting Attorney, Jen Futterman. So we have a strategy for you. We have some timelines, and go ahead, Kurt, and outline the timelines that we discussed.
Sure. Okay. So what we're looking at doing is having a draft ordinance on the expansion of the Board of Health prepared by February 22nd for consideration, and then recommending at that point to have on March 1st set a public hearing to take place on March 22nd for public input on that draft ordinance. And then once that information is brought back together, then move forward with whichever way the board wants to go on how to expand the Board of Health in accordance with and meet the requirements under Engrossed House Substitute Bill 1122.
And maybe following up to that, there is not a requirement for you to hold a public hearing that I think is advisable in this case, considering the nature of this particular ordinance. So I think it will be good to get some public testimony before you consider adopting this ordinance. And this ordinance really outlines the umbrella, and you will see more specificity when we distribute that, hopefully a couple of weeks in advance for your review. So that is probably the first step that we need to take. After that is really the implementation of the ordinance that requires the requirement of those new members. It's still up in the air, is the tribal representation. Even at the state level, it appears to be that it's only one representative that is to be assigned at the state. But that continues to be a source of conversation at the state level as to how that representation for the tribal members should be put in place. The statute is very specific. It states for a tribal representative, so that means just one. But we'll continue to work on that. I know that the rulemaking is not due until July, when the state needs to be finalizing the rulemaking. But if there is a need to change the ordinance that you may consider passing in late March, we will probably just amend it just to align with the rulemaking. And that seems to be a little bit odd in terms of the timing, because the state law requires to have something in place in July. And the state Department of Health is not expecting to have the rulemaking done by July 1st. So I think it is good for us to move forward on this particular ordinance for you to consider. And again, there's going to be a lot of moving pieces as we move along and start implementing this law. Questions?
Commissioner Mejia.
I think it's a work in progress. I've joined several meetings in regards to kind of what other counties are doing, and it's so up in the air. And I'm not even sure how it's all going to come into place. And I'm glad that Commissioner Menser is at the helm of this.
It seems like, I don't know the actual breakdown, but anecdotally from the meetings I've attended, it seems like Thurston County is again in a somewhat unique position, like we are with our Board of County Commissioners, in being about the biggest county that hadn't already expanded the Board of Health. We're still, we're like the last biggest county with 3 commissioners, and we're like the last biggest county with the 3 commissioners serving as the Board of Health. So it seems like a lot of other counties have already addressed this in various ways, and so they're making tweaks here or there. They're not completely wholesale having to reinvent the Board of Health the way we're going to have to. So anyway, it's interesting. Commissioner Edwards?
No questions, sir.
Okay. Yeah, and I guess I gave a heads up to both Ramiro and Kurt that I had heard some news, 3 weeks ago maybe, that maybe it wasn't clear what the tribal. So you guys, Ramiro, you're saying that those discussions still happening. Is that kind of the latest and greatest information post what we talked about maybe 2 or 3 weeks ago?
Yeah, and in fact, I attended the WASAC meeting, and one of the breakout rooms was this particular conversation. I asked a question in the breakout room, And that seems to be a consensus because they reached out to the sponsor of the bill when this was introduced to the legislation. And that was the intent. There was going to be a representative, tribal representative to a Board of Health. Considering here in the county, we have 3 federal recognized tribes, and we're probably in the middle. Some other counties may have close to 10. So it becomes a little more complicated on that process. So going through the state and the tribal, I can't remember the name of the organization at the state, where they will assign a tribal representative. That seems to be the take as of later. And talking with Jane as well, reading the statute, it speaks about a tribal representative. It doesn't say tribal representative for each of the federal recognized tribes. It's something that a moving piece, even on the draft rulemaking by the Department of Health, which I will highlight that next week as well. It states about a representative assigned by the state. So it seems to be that is the way it's moving forward, but we'll continue to watch, see how that evolves.
Okay, and then so if I understood the timeline, March 22nd, potentially a public hearing, and then the Board of Health could potentially take action at the April meeting. Is that the thought?
Actually, the Board of County Commissioners need to consider this, and then
we have more choices.
Yeah, and then
all right. Well, that gives us more dates to work with because the Board of Health only meets once a month. Okay. All right. Any questions from the board right there?
No, sir.
More to come. Okay, then we'll have our standing items, which is the Board of Health members' reports, the health officers' report with Dr. Abdulmalik, and the director's report. And if there's no questions about that, that'll cover Board of Health next week.
Chair, could I ask one?
Yes, sir. Yep.
Might we have some kind of a report about how we're coming on Ensign Road? I mean, it was a Board of Health thing, basically, and I'm hearing from citizens that things haven't changed that much, and where are we at, kind of. That's all.
Kurt, is that something you could report on in your director's report, hearing that question of Commissioner Edwards, or we could add a brief update from Tom as a new item? It's up. I guess I'd leave that to your discretion. I'd like to accommodate Commissioner Edwards' request one way or the other.
Well, let me work with on the agenda, and we'll see if we can get an actual standing item. If there's not enough updated information for an actual agenda item, I'll do it in my director report, but we'll try to get it included as an agenda item.
Okay.
There should be enough for an agenda item. I guess the only reason I was bringing it up about an agenda item is because then citizens that are interested can pay attention and they know we're going to talk about that issue as well.
Because it's listed out. Yeah, that makes sense.
We'll reach out to Tom, and either Tom or Keely to give an update.
And very
good.
Very timely.
Okay. Yeah, thank you, Commissioner Edwards. Good idea. All right, because we lost one of our other agenda items, so that slots in perfectly. Okay, if there's no other questions, I'll pass it back to Madam Chair to move forward.
Thank you. Okay, and then our next item is proclamation and awards.
Good morning, Amy Davis, clerk of the board. The proclamation for African American History Month is scheduled for February 8th and included in your packet along with this year's schedule. And that is all for proclamations.
Thank you. Questions, comments?
No, ma'am.
Okay, perfect. So next, we're moving on to advisory boards and commissions.
Included in your packet are 3 applications and 1 letter we've received. The first application is from Chris Dolman for the Agriculture Advisory Committee as a farmer member. It is my understanding you'd like to hold off on appointments to this committee until the handbook and resolution are passed, but I'll continue to bring the applications to you so everyone has them. That is all for that one, unless there are questions.
Go ahead, Commissioner Menser.
I guess my question is just, and this can happen next week, it doesn't have to be right this second, but just orienting us as to the Agriculture Advisory Committee slots, like who, I seem to remember we had a farmer position open even before, like even as of last year. I can't remember how many positions were open and are open now. Somebody was, I think we had one open, and then somebody was coming up for reappointment in January, and that didn't happen. And then I heard somebody might have resigned. So I just kind of would like, I think the board needs to kind of know, where does that committee stand in terms of the slots?
Yeah, I will bring an updated roster next week.
Okay, thank you.
So I attended, I would like to talk about this committee for a little bit if possible with the commissioners. I attended the previous meeting for an hour, and Mr. Johanna made public comment about me attending and then leaving, which 30 minutes of that meeting was 3 members laying out and you know, at the meeting that they were leaving for various reasons. I don't think we've received official resignation letters yet. So after that, I decided to stick on for a little bit longer, and then I departed. But, you know, just in regards to his comment, you know, I feel commissioners attend whatever advisory boards they want just on time that they have. I try to pop in on some whenever I have a chance. I attend the agritourism advisory board every once in a while when I have a chance after our board meetings. And the fact that there was a public comment about me leaving an advisory committee that it's not even my assignment early, I thought was, it's very frustrating, just because this, I feel like we keep hearing back from this committee, and, you know, just being there and then seeing 3 members resign for various reasons. And again, I haven't seen the official resignation letters, so I don't want to dwell on that much, but, you know, I feel there needs to be something done with this committee. I mean, I feel other committees advisory committees are working so efficiently. And, you know, I specifically asked from this advisory committee about the agricultural liaison, if they would submit, you know, a letter of recommendation when we were going through the budget, if they would write a letter to support it, if this was something that they wanted, and I heard nothing back from them. So at this point, I'm just seeing a lot of things where I'm just getting very frustrated, and I'm hearing Mr. Hanna come back and criticize Commissioner Menser, criticize me for various reasons. And I don't know. I kind of want to lay it out there, because I thought that even though he says he's coming here as a personal citizen, then he's talking specifically about the Agriculture Advisory Committee and relaying out the information for that. So I just wanted to have a conversation with the rest of the commissioners about this, because I'm getting very frustrated. Commissioner Edwards?
There are quite a few long-standing members that are still on that committee. I think maybe it'll be beneficial if we had that list of vacancies that Commissioner Menser talked about, and how many openings and stuff we had. And then I have to say, I have listened to that meeting. It was a Zoom meeting, quite interesting. I'll just let it go at that for right now. But maybe when we get more information, and Amy brings that forward to us, and we have the changes, I think, in how our committees are gonna do business. I think that's coming up relatively soon. Maybe we can address all of those concerns. Chair, I guess that's, I don't know today, I don't have that information in front of me. So I don't even know who's on there and who's not. I know some said they were resigning. Whether they did or didn't, I don't know the answer to that either, so.
I guess I would just, I mean, Commissioner Mejia, I hear your frustration. I've had my own different frustrations. It did catch my attention as odd, the comment that it was almost like you were being criticized for attending a meeting that you had no, Commissioner Edwards and I weren't there, and you had no obligation to be there. And I think that, so that did strike me as odd. But there's, as you point out, there's been other things that I found odd. The most concerning thing is to have, you know, the resignation of the appointee that we made that was a target by the former chair. And then within just a few months, that person felt the need. And I haven't listened to it. I don't know exactly the stated reasons, but for any reason to have that person feel they weren't included and able to participate in that committee gives me great concern, because I already knew we were operating at a disadvantage there because of what happened with the previous chair. But it's something that I definitely don't want to just let go by. I'm going to listen to the meetings, and I was sort of waiting, as you pointed out. I was expecting there to be, I'd heard there had been resignations, but I expected to receive something in writing that would give me something to kind of chew on, or to bring to the board for discussion. And hopefully we can have that discussion, and the information Commissioner Edwards talked about is, I think, valuable too. But I think we should agree in fairly short amount of time to address kind of what's going on.
Okay, so with that, there is a new appointment, and so I guess we'll wait on that and more to come. Amy, I'll hand it back to you for the rest of the items.
Thank you. The next application is from Chris Hoffman for the Historic Commission. Historic Commission staff has confirmed that the applicant meets the appointment requirements and would be able to fill the vacant District 1 seat the Historic Commission has. As an individual who has a professional or an interest in and involvement in historic preservation. So this is included for your review, and I'll plan to circle back next week unless there are any questions.
Real quick, is this one where the committee actually meets the person and gives us a thumbs up, or are they just saying that they meet the application meets some kind of statutory criteria?
Yes, that's correct. The Historic Commission, you may recall, has various requirements for appointment. It has like archaeologists, folks appointed by cities, and there was quite a list of appointee requirements for that one, and I can provide the Historic Commission one-pager next week as well.
But did they actually vet this person in any way? I'm just curious.
They reviewed his application.
Okay, just from a paper standpoint.
Yep.
And they don't have any, okay, thank you.
And I reviewed the application. I don't have any concerns or problems. Commissioner Edwards, comments?
I have as well, and I don't know, just the mere fact that he moved up here from a tragedy and wants to get back involved, and I'll compliment him for doing that, I guess. Sounds okay to me, that he's interested in it, so, and we've got openings. And he probably wants to know more about our community, probably too.
And that's one, the Historic Commission, that has a lot of statutory requirements. So it's always great when we can get someone that fits into one of those. So, okay, Amy?
The last application is for the Storm and Surface Water Advisory Board's vacant at-large position. On the back of the application is the recommendation letter received from the chair of the advisory board, Jacqueline Simmons. SWAB met with the applicant and reviewed the application at their meeting on January 20th. And again, this is included for your review, and I will plan to circle back next week for your direction.
And questions, comments?
No questions.
Okay. And Amy, back to you.
Thank you. Lastly, I would like to share the letter received from the Chief Clerk of the Boundary Review Board, Katrina Van Every, informing us of a vacancy that was created by resignation on the board. The rest of that board is comprised of 2 members appointed by the governor, 1 by the mayors within the county, 1 by the Board of County Commissioners, and 1 by the Boundary Review Board itself from nominees of special purpose districts. The appointees may not hold other local elected or appointed positions or jobs. And this vacant term expires on January 31st, 2023. So about a year left. And this is just included for your information. And I'm happy to work with your offices to help in any way to bring forth an appointment. And that is all I have.
Okay, questions and comments on this? No? Okay, thank
I
you.
do real quick.
Oh, okay, go ahead, Commissioner Menser.
So out of all, guy, I looked at this letter. The person that we lost is, which one do they fall into? Governor or mayors or commissioners or Boundary Review Board?
I believe they were appointed by the Board of County Commissioners.
Okay, so it's ours. And then is this the one? Oh, maybe I'm mixing it up with the salary commission, but there was one where there's the code said that like we had to find someone within 30 days or something. Is it Boundary Review Board? Or is that, am I mixing that up with salary commission?
That is not Boundary Review Board, as far as I know. Maybe Salary Commission.
Okay, and this person, they must be resident Thurston County. They can't, okay, so it's pretty much wide open as long as they don't hold another local government job.
Correct. Yeah.
All right, so you're gonna do what? I mean, how are we gonna go about filling that?
We'll work with Megan for a news release, making sure that we posted there is an available vacancy, maybe explaining what the Boundary Review Board does. And hopefully we can start recruiting that way and receive some applications for your consideration.
Boundary Review Board, okay. For some reason in my head, I was thinking Board of Equalization, and we're talking about the Boundary Review Board. Okay. All right, thank you.
Thank you. Commissioner Edwards?
No, I'm good, thanks.
Okay, perfect. Okay, so moving on to our next item, PIO check-in.
Good morning, Commissioners. Megan Porter, Public Information Supervisor. I have nothing new to update, just continuing work on the items I've been reporting out the past few weeks.
Thank you. Questions, comments? Commissioner Edwards?
No, thanks.
Commissioner Menser?
No.
Okay. Thank you, Megan. And then moving on to legislative update.
Thank you, Madam Chair. I have updated the report. I am not going to walk you through individual bills. I think we discussed that in, I believe, in length last week. I'm just going to provide a couple updates and go through a couple of new bills. What you see in red on the left column is just a substitute of the original bill. I will not be going through the process. No significant changes to that. So a couple of revisions. Moving on to page 3. And that's substitute House Bill 1684. There's a typo. Commissioner Edwards did not oppose that. Had a question last week, and I addressed that question. But I believe there was support related to the fluoride on drinking water, and I provided that recommendation. So we fixed that on the report. Moving on to our next page, that will be page 4. In the middle, have a couple of red lines that will give you an update as to where those bills are moving forward. Moving on to page 5, and that is a new bill. It just came into our radar. That is a Substantive House Bill 1918. And this is related to emissions. And it states that beginning on January 1st, 2023, the tax imposed by RCW 82.08.020 does not apply to the sale of zero emissions outdoor power equipment. Each seller of outdoor power equipment must notify potential customers of the effective 0% sales tax rate established in this section for zero emissions outdoor equipment. Also, this piece of legislation includes the beginning on January 1st, 2025. State agencies as well as local governments may only purchase outdoor power equipment that is zero emissions outdoor power equipment, except for a couple of occasions. One is that this requirement applies only to outdoor power equipment that it has less than 25 horsepower. And the other exception is this will not apply to emergency response vehicles. So this is a good piece of legislation. I believe is aligned to the climate initiatives the board is considering. So my recommendation is for you to support it. Moving on to the following page, and page number 6, on top of the page, House Bill 1965. This is our bill related to veterans levy as well as the developmental disabilities levy. There was a hearing last Thursday. Commissioner Mejia testified. Good job, by the way. And also Robin Campbell, Assistant County Manager, testified on this proposal. There was some support, and there was one comment by a commissioner from Yakima County in opposition of this bill. But the reason for the opposition was more related to the state should be the one who funds veteran funds, not necessarily local governments. So that's where we are. Would you like to provide any perspective on that, Commissioner Mejia?
Well, I thought it went really well. We received good feedback from it. So I thanked Juliana from WASAC yesterday for attending and commenting. Again, I think the only feedback we've gotten from other counties who are not fully in support of it has been that they think that it should be a state priority instead of a county priority. And but other than that, they're in support of it. So.
And I'll be working with Deborah Manguia to see if this bill moves out of committee. So I will keep you posted whether that happens next week or not. Thank you. On the same page.
I'm sorry. Can I ask one question? I thought it hadn't moved into executive yet.
Yeah, but that's what probably we're looking for when that date has been scheduled. So that will be out of the committee to an executive session. So I don't know the date yet. And I will follow up with Deborah.
Thank you.
On the same page, you have a House Bill 2022. That is a new bill. And this bill requires the Liquor and Cannabis Board to issue 38 new cannabis retailer licenses and 25 new cannabis producer processor licenses each year in 2022 and 2029 to social equity applicants. The limits of issuance of cannabis producer processors, retailers, and any new license types created through 2029, so licenses may only be issued to social equity applicants, and begin in 2030 requires 50% of new cannabis licenses issued to be to social equity applicants. In the surface, it appears to be a good piece of legislation, in my opinion. However, the next two pieces what raises a concern to me. is it authorize the cannabis licenses issued through the social equity program to be mobile and for premises in any local jurisdiction that permits the business activities. The mobility of that business raises concern to me, and also reduces and eliminates certain distance restrictions in cannabis licensing for social equity licenses through 2029, and for all cannabis licenses in 2030. So I believe the intent of this bill is good, but the mobile aspect of this bill seems to be raise concerns because we as a county will not have any opportunity to govern as to where those locations will be. And also having the eliminate the distance restrictions, meaning from some areas the board has already put some boundaries or setbacks. Those it appears to be eliminated. So my recommendation at this point for the board is to be neutral and see how this bill evolves in the process.
I just wanted to ask, is there a definition of social equity applicant? I don't really understand what that means.
So I was trying to see the definition. I didn't get to that point yet, but I will. So let me see the social equity plan definition. The social equity plan is currently defined as a plan that addresses at least some of the following elements. And a statement that an applicant qualifies for a social equity applicant and intends to own at least 51% of the proposed candidate's retail business. Okay, here's the definition. Sorry, I got it. The definition of social equity applicant, an applicant who has at least 51% ownership and control by one or more individuals who have resided in a disproportionately impacted area for a period of time defined and ruled by the Cannabis Board after consultation with the Commissions of African American Affairs. And an applicant who has at least 51% ownership and control by at least one individual who has been convicted of a cannabis offense, a drug offense, or as family member of such an individual, or an applicant who meets criteria defined in the rule of the Licensed Cannabis Board after consultation with the Commission of African American Affairs and other commission agencies, community members and determined by the LCD. So that's the definition that I have. A little bit confusing.
Okay. Between that and the mobility piece, yeah, it sounds like this is pretty complicated.
I have a question.
Yeah. So that, go ahead.
Well, no, I don't know if Ty's done. I was waiting.
Well, I would just say I definitely support being neutral on this until we learn more about it.
Go ahead, sir.
I think for all the reasons that's been laid out here, I can see a lot of abuses coming. Anytime you have specialty groups that can sign on the license and get other people in under the radar, they can call it 51% if they want, but I don't think it works that way in reality. And I don't think government should be picking winners or losers. And so I'm opposed to this for maybe those reasons plus the others stated. So I just don't mind saying where I'm at on it.
Okay.
So my recommendation is to be neutral, but you have a difference of opinion here. Maybe I can just leave it blank, or maybe the board members to have the opportunity to read in more detail. And I will bring this item again, and hopefully by next week, I should probably give you a little more detail the status of this piece of legislation. I'm sorry, Madam Chair.
Oh no, I was just gonna say I would need more information on this. I'm kind of confused on how this all would work, and so I think maybe leaving it blank for now until we find out more information, and then or remaining neutral. I just don't have all the details for it to really come to a decision.
And So it is scheduled for an executive session this Thursday at 10 a.m. So I will keep you posted as to how that goes. But again, it's House Bill 2022.
And I'll look that one up. Thank you.
Does that come up at, sorry, Commissioner Mejia, has that come up at WASAC at LSC at all?
No, it has not.
Seems like WASAC would be opposed based on the mobility piece of it. I don't know.
I have not cross-referenced if this is on the hot topics of GWASAC, but I will do that. This just came to my attention over the weekend. And I figured that probably that's something the board may need to discuss anyway, so.
So I can bring it up this week at the meeting, but we really haven't had much discussion on this or any at all. I think it was just reviewed kind of on the bills that they were tracking, but not really something where we had actual discussion on. But I'm happy to bring this up and kind of see where other counties are.
Okay. That is that in the report, and also with your indulgence, Commissioner Menzer, I'd like to probably walk through the board members of the Thurston Climate Action Legislative Priorities. It just came up yesterday.
Okay. Yep, I got it.
Yeah, and briefly, I just want to walk you through what the Thurston Climate Action is supporting. Is House Bill 1774, the companion bill, Senate Bill 5722, which directs the State Energy Office to create energy benchmarks for categories of buildings in climatic regions, so prospective purchasers, tenants, and investors can make informed decisions. Next, they are in support of House Bill 1770 and the companion bill, Senate Bill 5669, which allow jurisdictions to adopt local residential building standards to reach beyond the state minimum code to support a faster shift towards efficiency and electrification. The next bill they're supporting is House Bill 1766 and the companion bill, Senate Bill 5668, has statewide deadlines for phasing out use of natural gas in all new residential construction and new commercial industrial non-process uses. Next is fund a pilot program to convert from gas to oil to electric heat and appliances in 100 existing low-income housing units. The request is for $2 million. The next is support House Bill 1280, and that includes the reduction of carbon footprint of state government, a top employer, an energy user in the Thurston region. Related to transportation, they're in support of Senate Bill 5312, and is to facilitate a dense transit-oriented development in urban areas. Also on the transportation and land use, they're requesting to, in the transportation budget, to emphasize support for transit, active transportation, commute trip reductions, and a shift away from fossil fuels. On the agriculture and forest area, the Thurston Climate Action Team supports Senate Bill 5633, companion bill House Bill 1895, which provides funding to acquire community forest land to be managed for sustainable harvesting and carbon sequestration. Also, they're requesting to fund a sustainable farms and fields grant program through the Washington State Conservation Commission to increase carbon sequestration on agricultural lands. Also, they're requesting to provide funding for prairie preservation, called for the Habitat Conservation Plan to enable development to occur within their urban growth areas while preserving existing prairie land outside the urban areas for endangered species in carbon sequestration. The request is for $10 million. That is the report from the Thurston Climate Action. That's all I have for you on that item.
Okay, questions about any of the bills? Commissioner Edwards?
Well, I guess this always makes me wonder, are we being Jenny smart, pound foolish? I don't know. There's a couple of old sayings that could go along with this, but when we convert to electric from natural gas, for an example, and then the electric is being produced by coal-fired plants, and I don't know what we have in this country, about 30 of them. If we lived in a bubble, all this stuff would be relevant, but we don't. We live in a global situation. And Pakistan, India, Russia, and China, I believe, are putting on a dirty coal-powered plant every day, which is affecting the earth, no doubt about it. And at least our coal-fired plants are very clean burning plants in comparison. So by sticking our head in the sand and disregarding what's going on around the world, we end up driving up the cost for our citizens, and many times it's those individuals that can least afford it, while the rest of the planet gets polluted. And if we did everything we wanted to do, we would only have an impact of about 2% on the whole world activity because of what's going on in the third world countries. So I don't have a solution. I'm just got a frustration that we drive ourselves into being a third world country ourselves, and nobody wins in the end. So I don't know, just my concern. I know that these folks are very well intending and wanting to do the right thing, but you know, it's just like electric vehicles. I mean, they're made out of plastic in most regards, and plastic comes from oil, and oil comes out of the ground. Battery material comes out of the ground. Slave labor creates batteries in China. And so, I mean, I think the intention is well, but the reality of it all really bugs me when we get so carried away. And just a few years ago, natural gas was recognized as better alternative than others. Not perfect by any stretch of the imagination, but I just don't see that we can keep up with the demand, and we're gonna have brownouts nationwide here before long, similar to what California has. So I don't know, just a frustration of mine. I know they're well intended. I wish we could figure out a way to get there, but I'm not sure all these mandate things that just drive up cost are the answer. So that's it, ma'am.
Okay. Commissioner Munster?
I guess in response to Commissioner Edwards, I think that, you know, the last administration didn't want to engage the world with, you know, whether it's Paris Climate Accords, or didn't want to follow any rules and try to hold others accountable through international agreements. That's what we have to do. So I'm glad to see this administration re-engaging with those conversations and those treaty mechanisms, because that's the way we're going to try to address what you're concerned about in Pakistan, Russia, et cetera. We don't have, you know, they're sovereign countries, and we have only limited ability to control what they do, but those are the mechanisms that we need to be pursuing. So you're right about part of that, but you know, it's something that we need to drive forward on every level, not just our level, not just the federal level. And that's, I think, what we're trying to address here.
Okay. With that, we'll move on to briefing, public hearing, decisions pending.
Nothing is pending, Madam Chair.
Okay. And then commissioner items, and the first item is the Veterans Fund update.
Yeah, thank you, Madam Chair. I have asked Mark Moffett, he is the manager of the Veterans Fund and the Advisory Committee. So to come back and just provide a quick update as to where we are. I believe nothing is specific, but it is good for the board to hear where we are. So no decisions are expected from you today out of this briefing. Is an update. So go ahead, Mark. Or Kurt, whoever wants to take.
Good morning, Commissioners. Mark Moffett, Program Manager for Social Services at Public Health and Social Services, and the Incident Commander for the Incident Management Team for COVID. I'm here to talk to you about the Veterans Assistance Fund, or program. I believe you have the overview that I sent over. Hopefully that you're reading that. That's what I'm going to go off of today. I picked several points that I thought you might be interested with the program. The first one is, how are we spending the fund with direct services? On the first page, you'll see 3 graphs. The first graph shows rental assistance by itself. That's by far our biggest expenditure for veterans when they come in. That's what they're looking for. So rental expenses, our assistant also covers mortgages. We just call it rental. So I also wanted to compare several years for you as well, so that you can have a visual representation of what the trend looks like. And I also included additional information so that you have a direct comparison, apples to apples. So if you look at the first graph, it goes from 2013 to 2021. The blue lines are the rental assistance, everything that comes out of that for rental assistance. If you look at 2017, 19, and 21, you'll see an orange bar next to the blue graph. What that does is it takes out the amount of money that we support the Lacey Veterans Fund with rents. So just to give you a good comparison so that you can see how much we're spending directly on veteran rental assistance. What's important to note on this, looking back at 2014, we helped out a lot more veterans, but the amount that we spent on each veteran ranged from $150 to $800 each time. Whereas last year, we spent between $1,200 and $6,300 per veteran. And a lot of that is because multiple months they were behind in rent with the moratorium ending last year. We saw a little spike at the end of the last year and beginning of January of veterans coming in for rental assistance. So we may see that trend continue. I really don't know. But that's just to kind of show you, we had a dip starting in 2013, and we've kind of leveled off for the most part over the last 5 years, with 2 exceptions in 2018 and 2020. Possibly 2020 could have been a COVID. People weren't leaving their homes. They weren't coming to the Veterans Hub in Lacey, so we didn't see as many people coming through. The second graph, shelters. So we contract with shelters in the community to provide beds for homeless veterans. You'll see in 2019 we spent nearly $50,000 supporting homeless veterans, and those are bed nights. So we don't give a certain amount to the shelters. They provide the service, and then they give me the invoice for each veteran, and we pay it per night. So in 2019, we actually had 2 shelters working for us. We had Catholic Community Services and Salvation Army. Salvation Army was not able to continue on the last couple of years because of construction at their site. So 2020 and 2021 was just representative of Catholic Community Services, which kind of illustrates the drop in numbers potentially. The final graph, the combined direct services. So that includes all of the direct services, our main direct services. So that includes rent, utilities, burial, and shelters. And again, you see the same trend. We had a dip in 2020, and it seemed to rebound in 2021. I'm going to throw a couple more numbers at you that I think are important. I don't want to get lost in them, but it's very important. So going back to 2019, we had 109 veterans start the application process. Of those 109, 33 never returned. They didn't return our phone calls. They didn't return emails. They just didn't continue the process, so we weren't able to help those 33. 18 were not eligible for the program. So either they were over income, discharge status, or they used it more than twice in their lifetime. In 2020, we had 48 come through the door to start the application. So less than half of the previous year. Of those, 15 didn't complete the process, and we had to turn away 7 because of the same problem. So over income, discharge status, out of county residency, or they used it more than 2 times. Now, keep in mind, over the last 5 years, we have changed the policy 4 different times to try to bring more to help out more veterans. So, and you're going to see that in 2021 with the numbers. So we didn't see more people coming through the door. We saw 40 come in and start the application. 17 never came back, didn't respond to emails or phone calls. And we only had to turn away one veteran that didn't qualify, and that's because they wanted a down payment for a home they were purchasing in Clark County. So we don't spend money for outside of county. So as you can see, I think the policy revisions are helping. What we need to do, and we've talked about this at the advisory board, is to market the program throughout the county more. And we started that last fall when we did a Thurston Talk interview to promote it. And our advisory board members, they have a lot of good ideas. We just had our quarterly meeting last week, and they have a lot of ideas to help get the message out. So we'll be working on that. Any questions on any of the graphs, commissioners?
No.
Questions, Commissioner Edwards?
No, ma'am.
Questions, Commissioner Menzer?
No.
Okay, and I don't have any questions either, Mark.
Okay, great. So policy revisions that are going to be coming to you within the next month or so for our next revision. Remove the limit of twice in a lifetime. As I just stated, we lost a couple over the last few years because they, we did have a limit of the amount of times you could receive assistance. We want to remove that and treat everybody as an individual. And everybody has circumstances. It's an ebb and flow, and sometimes you're doing well, sometimes you're not. So we want to make sure that we're able to look at the veteran as an individual and not, in totality over their lifetime. We also want to approve car payment requests that they're late with. We're doing that now through a waiver process. So the waiver, if it doesn't fall within our policy and procedures, we can waive certain payments, and that goes, the advisory board has to approve, and then it goes up to the Public Health and Social Services Director for final approval. And then we also want to allow multiple waivers for veterans. And again, with the director approval, right now they're only allowed one waiver, waiverable item. So we want to remove that requirement as well. Again, treat everybody individually in that situation. Last fall, you approved an employment initiative to help veterans who are underemployed or unemployed, where we would pay for their rent, utilities, and help them find a job that they want that's going to help them provide for their families. We're still working on the details. I'm working with Morningside, which is a local organization that helps people find jobs, specifically people with disabilities, but they have the skill set that's going to help our veterans as well. And I'm also working with the staff and the advisory board to develop controls and benchmarks. Since there is a lot of money involved in something like this, we want to make sure that they're progressing through the steps at an appropriate pace, because we only have a quarter to work with them. And then veteran advisory board members, we actually, I need to update this. We only have one vacant position now. We actually have 8 people. And so the data on here is a little off. We have 2 from District 1, 3 from District 2, and 1 from District 3. I just thought you might like to know. So if you have constituents in your district that may fit our advisory board, please send them our way, and we'll be happy to fill them in. And then projects.
Mark, yep. Can I interrupt for a second? So you said there were 8 members currently?
There are. That just came to light yesterday, that we had one that was approved, but I didn't get that information. So
I'm only seeing when you split it by district. I'm seeing 6 members.
Yeah, I'm sorry. You're right. This is 6, so 7. So there's 7.
Okay.
There's 7. Yeah. So we have 2 open.
Okay. Thank you.
Yeah. Thanks for letting me clarify that. And then some of the projects that came out of the last advisory board meeting, updating the policy that we talked about, and then marketing and publicizing the assistance program to local businesses and organizations that veterans typically go into. And then our next quarterly advisory board will be on April 18th, in case anybody wants to attend, part-time to full-time, whatever you'd like.
Thank you, Mark. Questions, Commissioner Edwards?
Yes. Going back to policy revisions, Mark,
Yep.
Like on the limit of 2 times a lifetime limit. I'm not sure that that's the best way to do it, but I'm not saying maybe, you know, don't make it unlimited, because I think you end up creating dependency if you do that. But maybe 4 times or something, expand it. I mean, try it incrementally for a little bit and see what might happen, help those. And I see down here on allow multiple waivers for veterans with director approval. And who's the director?
Currently, that's Kurt Hardin.
And I'm not so sure that I would like to give the director possibly more discretion to help more folks, but I don't know how to do that exactly, because you're saying multiple waivers, and I agree with that, multiple, but not an indefinite amount. You know, so you've got people there every month waiting to make a car payment, for an example. And the payment for the vehicle, I think we could expand that, but I think we have to have some requirement that the person provide something towards that payment to give them some incentive to, you know, try to do better all the time rather than create a dependency issue. So I like what you're trying to do. I just don't think we ought to open the floodgates completely.
And thank you, Commissioner Edwards. You're right, and we're not doing that. What we're doing is giving the advisory board more flexibility to be able to help more. Each waiver is reviewed by the entire advisory board to make sure that they all are in agreement. They discuss what needs to be done. In fact, this week we have a waiver coming through, and the majority of the members think that we need to require a budgeting class for them. So each one's evaluated. We look at their bank statements, where they're spending their money, and so we do have that flexibility to say, hey, we can help you out with this, but we're going to need you to do this too.
Okay. Thank you for considering that. That's good.
Thanks, sir.
Commissioner Menser? I like the employment initiative, the working with Morningside. I would also recommend like the Lacey Makers space, where they're doing, you know, job training for construction type projects. And I think they're doing great work too. I'm not sure how we could collaborate with them. I know they're, you know, it's a field that sorely needs more people to get involved. And I attended the graduation as well as Commissioner Menser did. And it was just great to hear the stories of the people who go through that program. And I'm not sure if, again, just more options.
Did you say it was called Lacey Makerspace?
Yes.
Okay. Thank you.
Okay. So with that, thank you, Mark.
All right.
Just one comment, ma'am. Just one
Go
comment.
ahead, sir.
First of all, thank you, Mark, for the update, and also I think great conversation by the board when the advisory committee brings back some specific recommendations and for you to consider. That will be great opportunity for all of you board members to see how you like to agree with those recommendations, expand, put some sideboards. I think that's really the opportunity for the Board of County Commissions to see how those recommendations will move forward. So thank you, Mark.
You bet. Thank you.
Okay, thank you. Okay, and now we're moving on to item 2 under Commissioner's item, potential dangerous dog designation.
Yeah, this has been on your agenda for a couple of weeks. So finally, we had the opportunity to walk you through this. We received, I believe, in December 30th, a report of a person being attacked by a couple of dogs. I let Katie to walk you through the details of it. As a result of this presentation, staff has a recommendation for you to consider at the end after you have the opportunity to ask questions. Katie?
Good morning, Katie Johnson, Executive Assistant to County Manager Romero Chavez. Can you hear me okay?
Yep.
Yep.
Okay. So we're gonna talk about the declaration of a potentially dangerous or dangerous dog today, which would be a decision later, if you please. But the facts of it are we have Mrs. Wendy Ryle, who sent in this matter early in January. The incident happened Wednesday, December 8th. Her neighbors, the Sandinos, have two Mastiff dogs. Mrs. Ryle and her dog were walking at an intersection in their neighborhood, approximately 60 yards away from the Sandinos property, when the Sandinos let their dogs out of the car unleashed. The dogs ran towards Miss Ryle, barking, snarling, and knocked her over and attacked her dog, Topaz. The Sandinos rushed to try and restrain their two Mastiffs, where they had great difficulty doing so. And they broke free a second time when they finally were restrained and continued to attack Miss Ryle's dog. Attached, you'll find in your packet witness records. Two neighbors witnessed the incident, and they've included their statements. Miss Ryle wasn't bitten, but was knocked over and had wounds inflicted by that. There are vet bills and pictures attached. Mrs. Ryle did post the incident on the app Nextdoor, which kind of alerts neighbors to incidences and issues just in the neighborhood. She wanted to warn others about the attacks, and in doing so, she received testimonials in response as to the dog's aggression witnessed before and many others' experiences with these two dogs. So you will find all that documentation in your packet, along with Mrs. Ryle's statement and a record on animal services that she noted. So she does live in the unincorporated Thurston County area. So that's why we are taking care of that today. According to the code, Thurston County Code, if an action resulting in a designation, the following actions may result in a potentially dangerous or dangerous dog designation. Under one, the dog shall be declared potentially dangerous if unprovoked it A, inflicts a bite on a human or pet or domestic animal, either on public or private property. B, chases or approaches a person upon the street, sidewalk, or any public grounds in a menacing fashion or apparent attitude of attack. Or C, has a known propensity to attack unprovoked or to cause injury or otherwise to threaten the safety of humans or pet or domestic animals. So under those three, I would suggest, I and Elizabeth have reviewed this, council, so C would be an option. You could also go with A. I think that there are a couple to review there. I'll take any questions.
Questions, Commissioner Edwards?
What are you thinking for sure is, I mean, it looks, I don't know, it looks pretty serious, but.
As Katie stated, at least from the staff's point of view, the recommendations for the board to consider potentially dangerous dog.
Potentially.
Why wouldn't it just be A? I mean, it bit the, I mean, all the other stuff adds a like little levels, slight levels of subjectivity, but the first one seems like cut and dry. It bit a dog. It wasn't on its own property. It seems like we should just stick with number one.
I think under all of those, one is the potentially dangerous dog if unprovoked, and then A, B, or C. You don't have to define A, B, or C, just that it falls under those.
And then I don't have the code in front of me. What would it, can someone, maybe Elizabeth, remind me, what does it take to get to dangerous? That's when it bites a human, or is it, okay.
I have that in front of me if you'd like.
So that's the part we don't have is a bite the human, apparently, right?
Yeah.
Okay.
And also no known history. This is the first, at least the first reported incident with those two dogs. So that's another element, I believe, for dangerous dogs.
Well, it sounds like this would be an easy step to accomplish, doing it that way, and they'd be put on notice that better not happen again, or it'll be the next time around, so.
And also this designation is appealable. So if the board authorizes the staff to draft this letter for you to consider designating these two dogs potentially dangerous dogs, then we'll send that to the property owner, the owner of the dogs, and they will have the opportunity to appeal that decision to the board. And you have exercised that already, so.
Go ahead, Commissioner Munster.
So do both dogs get tagged, or did both dogs bite the other dog, or did just one?
It was a dual attack.
Yeah.
So both dogs' teeth were in that other dog?
From what I understand from the report on record.
Okay.
It's quite detailed in there.
Yeah, I read it and I just didn't remember trying to make that. I didn't have the code in front of me, so I wasn't focused necessarily on the elements of what I needed to focus on, but okay. So the proposal is to do a potentially dangerous designation to both dogs.
Yes.
Yeah, that is the staff proposal, sir. Yes.
Chair, could I ask another question?
Sure, go ahead, sir.
Is there something like double jeopardy or something on this deal? I mean, if we do have an appeal and it's so egregious that we feel that we ought to up the designation, could we do so at the hearing? No. Okay.
If an additional attack has occurred since the designation, absolutely.
Right.
But then it will be going through another process for you to consider a dangerous dog. But at this point, you're considering for consideration is a potentially dangerous dog, moving with the process, given the opportunity to weigh in, and if they want to appeal that decision, but at least that is the beginning.
Go ahead, Elizabeth.
I was just going to say that we haven't met the prerequisite to jump to designating these dogs as dangerous because there's no previous report on file.
Okay, thank you.
Thank you. And that was kind of where my question, what was kind of the difference that got it from one to the other. So at this time, I'm okay with moving forward with the potentially dangerous dog. Commissioner Edwards, how do you feel?
Yep, I'm with you.
Commissioner Munster? Okay, so you have 3 thumbs up, Katie.
Thank you.
So we'll draft the letter for your signature, and then we'll begin the process. Thank you.
Okay. Next item is item number 3, Fairgrounds Project.
Yes, thank you. This is another item that I think is it was of
We'll play with the arrow.
Elizabeth, your mic is on.
There you go.
Okay, thank you. This item is an interest of the commission, the commissioners, and let me give you a little bit of a background. A couple of years ago, the Board of County Commissioners set aside $250,000 to have a signature project at the fairgrounds. As we move along, I believe the Fair Board has gone through the process, determining what that project will be. I believe there has been many discussions on this. And what you will hear today, and Josh and Teresa are here as well as Robin, is what this project is planning to do, what are financial elements they have currently, and perhaps what is the next steps they're planning to take. With that in mind, Josh?
Great, thank you, County Manager. I am Joshua Cummings, the Director of Community Planning and Economic Development, CPED. We also have with us Teresa Reed, the Fair Coordinator. Just wanted to give a brief overview. Thank you, County Manager. That was an excellent lead-in. So there's a lot of different pieces that we've been pulling together over the past few months to utilize the $250,000 in a REIT. And just want to go through those real quick so that the commissioners have an idea of why this has taken a little bit of time to come to you and why we think that this plan is a good plan going forward. So first off, we had the 250,000 in REIT, and that's not a ton. That's not going to build a brand new building. We also then, the Fair Board and CPED applied for grants to the Washington State Department of Agriculture. And we were just notified in December that we were successful in receiving one grant for $250,000. So now we have $500,000 total for a potential signature project. We worked really closely with the Fair Board and other Fair representatives to engage in what they wanted as a project, what they saw for the future of the fairgrounds. And it was very clear that they wanted work done in the Willie White Pavilion area of the fairgrounds. It's a big open area surrounded by older buildings. Those buildings are currently used for boat storage and other items, but the Willie White building is a few years away from needing pretty substantial repairs, likely in terms of its structural integrity. So their hope was, the Fair Board's hope, was to do a phased project using the funds available to increase the infrastructure to that area, which would be water lines, extending them so that they're wider so they can carry more water to that part of the fairgrounds, which would allow for a fire hydrant, and then to demo the Willie White building and other older buildings to then provide flexibility in that space in the first couple of phases, and then build towards fundraising for future years to purchase an agriplex. So the first 1, 2, and 3 phases are what we would suggest funding with the $500,000, and that's essentially the groundwork. So it's demoing and preparing the ground and getting the engineered drawings and some of the permits that might be allowable. So that's all focused on adding flexibility to that area for use in the interim, demolishing old buildings that may provide future safety concerns, and preparing the groundwork for the future building. And then you can see in that one pager that I believe you have, the second 3 phases, 4, 5, and 6, would be directly related to constructing the building. But in the interim, this first phase of the $500,000 that the Fair Board is looking for your thumbs up, we would begin that work. So you should also know we've engaged with the Assistant County Manager. I'd let her have her conversation in terms of how first phase 1, 2, and 3 are tied directly to a future building and how that's an allowable expense for REIT. But I think that was a lot. So any questions?
Yes.
Edwards.
I'm having a hard time wrapping my head around $100,000 for the water line business.
So the Fair Board and other representatives went out and sought estimates from professional contractors, and that's where these numbers came from. We wanted to make sure we had a realistic representation. If we overshoot, then we'll spend the money on other things related to this project. But we wanted to be conservative in our estimates and not oversell a project to the commissioners.
And Josh, is that related to the requirements of this potential new building or fire suppression?
Correct. So it's the hydrant and the water line extension for the whole area. And it's quite a ways away from where the current water line ends.
I've had a bit to do with water lines, and that is surprising me that you would have that figure, but maybe I'm living in the past, I guess. How about the permitting process for an Orca demolition permit? I mean, $25,000 to take down the existing building?
Again,
is that like a dust permit, or what is it?
Again, these are overestimates to make sure that we don't overspend the money that the board has provided us. So we looked at the Orca permits along with other permits that might be required as we're doing some of the work, the groundwork. And we can provide a more detailed look if you'd like, Commissioner Edwards, but this is to just know if we're on the right path. We didn't want to drag our feet, as you say.
Boy. Okay.
Teresa, did you have anything to add from the Fair Board's perspective?
The Fair Board's very much looking forward to being able to start this phasing of this project. I know that it will make the area much more flexible and more usable for the fairgrounds year-round. And maybe to help answer some of your question, Commissioner Edwards, we do have to replace quite a bit of the existing water line because it's not big enough to carry the amount of water that would be needed for the fire hydrant. So it's not only installing, new lines, but replacing some of the existing ones.
Great, thank you.
And Robin, would you like to add anything in terms of the REIT? That's outside of my scope there.
I would just say that the REIT funding can be used for any of these projects that are in support of creating a useful public space. So even if you don't build a building, if you prepare the space, either prepare the space for a future building or prepare the space for uses for items such as large tents or other events that could be held there, then REIT is an appropriate use.
Commissioner Menser, questions?
No, if the Fair Board's good, I'm good.
I have some questions. So currently there's the confirmed funding source and potential, we would have like around, let's say $600,000. Is that correct?
Yeah, 500,000.
Okay. And then the potential funding is that extra 100,000 that we don't know yet?
Correct.
Okay, so
Yeah, oh, sorry, go ahead.
so with that 500,000, we would be able to complete phase 1 through 3. No problem. I think the issue would become once we move into phase 4 through 6, where Robin is saying we have the potential availability of REIT funding.
So REIT, no, that's okay. So REIT funding, the REIT 250 and the WSDA 250 would be used in phases 1 through 3.
Okay.
And even though phases 1 through 3 won't give us the fully constructed building, it will create a usable space. So the goal is to use the 500,000, or if not all of that 500,000, the remainder could go to the next phases. But we didn't want to, like I said, overshoot. So the REIT and the WSDA will be combined immediately upon thumbs up to start going forward as quickly as possible. I think I saw the county manager's hand go up.
Go ahead, county manager.
Thank you. I think what you heard today, commissioners, is a well thought out phased approach based on the funding availability that we currently have. You do have in your packet a letter from the Fair Board stating that they're very supportive of this phased approach. And I believe that if the board, with the board concurrence, is to move through in phases 1 through 3, start implementing those phases, and that will give us time really to find out, the financial strategies to complete the project down the road. I think it's a good phased approach for you to consider. If you're okay, I was looking for direction from you today on the phase 1 through 3. And again, this is not the end of the conversation because we'll need to come back to you with some additional financial strategies as to how you may consider completing the project if that is the case. So we didn't want to wait until we have all the funding in place to do the entire project because that would have taken months and perhaps years. So in this case, something that we can do that right away and continue to work on the ultimate goal of building a new building. So that will be my suggestion to you.
I'm there. I mean, might as well get started on it. I'm in agreement with the Fair Board and I'll follow their recommendation.
Yep.
Commissioners?
Yep.
Okay, thank you, Commissioner. So we move right now from phase 1 through 3. Not only that we'll come back to the board with alternative as to how you make the Fair Board as well as the county to complete the ultimate project. So thank you.
Thank you, commissioners. The Fair Board's going to be elated.
Thank you. Okay, on to our next item 4, the fireworks proposal.
Thank you, Commissioners. And this is, I don't know if you may recall, you had some citizen, Ms. Susan Yochum. They came back and provided testimony in a couple of occasions in 2021. And that was on the heels of the 4th of July. Right after that, it was a lot of testimony related to that you should consider banning fireworks from the board across the county. So at that point was what we asked is to have a conversation with the fire marshal, which just happened to be the director of CPED. Is right here. So he did engage with Ms. Yochum in a series of conversations, I believe, where a proposal came to the surface. I have some perspective on those proposals, but I will let the fire marshal, i.e. the director of CPED, i.e. the also known as Josh Cummins.
Thank you, County Manager. Yes, the Director of CPED and the Thurston County Fire Marshal. And so, as the County Manager stated, we did engage with resident Susan Yochum on a number of occasions. And it was important to me that we follow a process-oriented path. So I did ask her to submit using our docket code revision, our code revision application form, information provided to her, questions and what she wanted to see changed in our code. And she did so before the November 15th period. And what you have before you is the first sheet, kind of a one-pager of the 4 codes that she wanted to see updated. And I would say, well, this isn't a traditional land use item, which is why it's not included in your docket discussion that you're having with community planning. Given that I am the fire marshal, I thought it important that we take it through this process to see what the board might want to do. And the codes that are related that she's requesting to be changed are within Chapter 6. And you'll see down at the bottom in that little graph there, Chapter 6, which is 6.68055. That chapter is related to business licenses. Next chapter, Title 10, is related to public peace, morals, and safety. And then Title 26 is within CPED. It's code enforcement for land use. And so it's a little bit tricky in terms of the different chapters that are asking to be amended. But the main crux of it is in the bars right next to those 4 code cited areas. The request to the commissioners is to reduce the number of days for legal sale of fireworks, including restricting the tribes, restrict the sale and purchase, not only the discharge of consumer fireworks, including the tribes, and then request that the sheriff's office add fireworks as a finable offense for law enforcement, and then expand the work of CPED title of the code enforcement to then enforce any of this code along with the sheriff's office. So the main question to the Board of County Commissioners is, would you like me as the fire marshal to further pursue increasing restrictions on fireworks in Thurston County? If you do, I'll provide a more detailed research analysis on these requests.
I have a question.
Go ahead, Commissioner Edwards.
And tell me where it says including tribes, what makes you think that you have any authority to do that?
No, that's the request. That's the request from the citizen.
I know, well, they just don't know what's going on or what.
The practicality of that request is really in question.
Yeah.
Because we don't have any oversight as to what happens in tribal land.
Right.
So, and here's just a request. That doesn't mean that we should be able or be capable to do that. So that's a good question, though. But again, even the reduced number of the sale of legal fireworks, that's an RCW. They determine the sale of legal fireworks, whether that is within the purview of the county to reduce the days is something we need to explore.
Well, that's exactly the question. Would the county commissioners like me to explore?
So this is just a proposal by a citizen, not necessarily something that we need to pursue. But I'd like to give you a little bit of history on this, and let me take you back to 2016. None of you were in office, but it was when the board at that time, it was maybe a week before, 2 weeks before the July 4th holiday in 2016, with the then board was considering a ban of the sales and purchase of fireworks across the county, unincorporated areas of the county. At that time, it was a couple of cities already put that restriction. Leading to the public hearing, which it was held in room 152. I have been, I have experienced many public hearings, and that came really always on top of the list because the fireworks on both sides are very near and dear. And it was a very passionate, it was absolutely passionate public testimony on both sides when the board was considering. It was not until all the public testimony that at the end of that meeting, and I think Elizabeth can remember that, we scrambled and drafted that draft resolution. And that resolution is still in place. Depending on the danger fire conditions, the county manager can ban the discharge of fireworks, no banning the sales and distribution and purchase. And that's how that resolution came to be. It was really, really based on the very emotional public testimony that was received at that time. So this is just more a historical perspective for the board.
Commissioner Menser?
I'm taking it all in.
Yeah. So commissioners,
So this is a very and again interesting issue, and it's not the first time this comes to your attention. Every year we receive public testimony as to what the board should consider banning the sales and purchase of fireworks. And in fact, I believe the state legislature has a new bill a couple of years ago. They eliminated the waiting period because I believe that back in 2016, if the board were to adopt a restriction of the sales and purchase of fireworks in unincorporated areas of the county, it was a year-long waiting period before that took into effect. I believe the legislature, let me double check, took that waiting period out. So that is something that has evolved since 2016. But as you're taking all in, this is going to generate a lot of passionate positions from both sides. So my 2 cents.
Madam Chair.
Go ahead, sir.
Is there anything in there that, or in the past, that was talked about the urban growth area of the municipalities? Was that discussed at all versus general rural America?
And at least when I participated in this process back in 2016, the UJ was no part of the discussion. It was mainly municipal boundaries and unincorporated. Yeah.
And did we ever need to say it was illegal to discharge fireworks because of, I don't know, fire problem or anything? Did we ever do that?
No, I don't think it came to that point. And I think how the ordinance that we currently have in place, that it was enacted as a result of the public hearing, it was also on the heels of this very dry summer that we experienced in 2015. So that's probably give the board at that time the avenue to implement the current ordinance that we have in place. But to answer your question, the county manager has not exercised that right since.
Or the fire marshal?
Or the fire marshal. In consultation with the fire marshal.
Well, I have to say, it's been a long-standing activity, I guess. And my concern would be enforcement. or an inability to do enforcement, basically. And now, with what's going on, you know, with hardcore criminals, I mean, the cops can't even chase them down when they know, you know, they're the bad guys. So I just don't see this as a issue to try and add enforcement issues on law enforcement, especially when you've got the tribal issues going on where we're not going to affect the regulation of sales. So I'm inclined, and I'm not kicking the can down the road. I'm just inclined to go along with what we've got. If there was any discussion, I'd be somewhat interested in the urban growth area, possibly. I'm not even committing to that because I know all about those issues of community interest both ways. So, you know, we can put an advisory vote on the ballot or something like that. I'm always in favor of allowing citizens to vote, but it has to be on something for, you know, few years down the road type of a thing, and lay it out in that regard. So anyway, just food for thought.
Commissioner Menser?
I have trouble with this issue because if folk, where I grew up, you didn't have tribal sales of fireworks, and all you could get is like the little packages of very small stuff at Safeway or whatever. And I think if that's what we had in Washington, I would be a pretty strong protector of the people's right to just go out and get those packages and just, you know, shoot off the fountains for the little kids and stuff. It's pretty safe. The problem in Washington is that we have the tribal sales of more like powerful, and we have so much shoreline that as I've lived here a long time now, I know many families who it's like a cultural thing. Like you can shoot these you can get these powerful and you can shoot them over the water, which is much safe, you know, probably more safer way to do it than over dry brush or the places that I grew up over a neighborhood or whatever. And so I know I know lots of people that do that, and it's been done for many, many, many years, and it's kind of part of their family culture, and it's not something I'm familiar with like as a child. So between those two elements that are very different here, I think it makes it hard because to my knowledge, these codes and rules that we've come up with don't really distinguish, you know, between grade A, grade B, or grade C level. I mean, I don't know all the different names for things. You know, you hear about bottle rockets and this, that, and the other. There are things that I know are more, I mean, I've seen people get stuff and it looks like slight exaggeration, but it looks like a pretty professional fireworks show over, you know, the lake or I was on Whidbey Island one year for 4th of July, and it was incredible what they were shooting out, you know, over, and it was just kind of ad hoc. It was not regulated. It wasn't, you know, a permitted activity. It was just citizens that got a hold of this stuff, and they did that every year from their cabins on Whidbey Island, as an example. I know Lake St. Clair, I think they do a huge thing so every piece of this has a problem. You know, the enforcement is definitely a problem. I don't like, you know, when we have rules but they're not enforced. That just kind of goes against my nature as a law student or as a former lawyer. But I do understand now that I'm inside of county government that, you know, we could pass a code that says CPED has enforcement, but I mean, CPED's enforcement capability is, you know, we've tried to beef it up, but it was down to a very threadbare condition. I don't think that, you know, we would have to take action to make that meaningful. Just saying CPED code compliance could go out there and deal with it. There's, you know, they struggle to deal with all of the land use issues and different things that we've already given them responsibility for. I know the sheriff's office doesn't have, you know, we've talked to the sheriff about that, and that's an issue. So looking at the sale of day, you know, we've got the issue of we don't control the tribes. We've got the issue of, okay, so if the board restricts the sale days and the sale but we're not including the tribes, like who are we actually affecting? And is that going to make any difference? Making it a finable offense, I don't necessarily have a problem with that. If we have a rule and we want people to follow the rule, maybe that's a deterrent effect. That might have some sense to it. But then you get to adding CPED compliance authority. I don't think that really works, given the financial realities, the staffing realities, and this is dispersed all over the county. So, and I live in a UGA myself. I mean, for me, it's like, we have our neighbors that like, don't let us do it. So like the minute any household in my neighborhood, even with little dinky, Safeway packages, there's people that say, you're scaring my little dogs, please stop. And we, out of respect to our neighbors and our neighborhood peace, we respect that. So I don't get to do it. Doesn't matter what the rules are because I respect my neighbors, but I don't know. So those are all the things kind of bouncing around my head. I'm not sure how effective any of these proposals might be given our constraints and realities.
Maybe I could just follow up on Commissioner Menser. He's referred to Mercer Island, or Whidbey Island, but I can tell you that same activity takes place over every lake in this county.
Yeah.
And every shoreline too.
Yeah, and I will say, as a general rule, the citizenry is pretty good about the cleanup afterwards of this stuff, because it does create a mess, but they do seem to clean it up, these different communities. So I don't know. I think we have too many complications, and let the state legislature worry about it, I guess. I'm not. Like I say, I'm not kicking the can down your road. If we all played by the same rules, it would be a different ballgame. But we don't, and that's the reality of life in Washington State.
So with where I'm at, and Josh, and I'll hand it over to you, I'm kind of on the same line as Commissioner Edwards' previous comments and as well as Commissioner Menser's comments. I just, just seeing the calls last year, there's no way our sheriff's department could just handle all of that. There's really no way for enforcement. And just, with our tribal partners, we can't, we have no oversight on what they decide to do. So for me at this point, I just, I'm not there yet, just because I don't think we have all of the framework for this. So I'm right there with where Commissioner Edwards is at, and I believe Commissioner Menser. Director Cummings, I'll hand it to you. You had your hand raised.
Thank you. Well, I appreciate the input from each of the commissioners. I wasn't here for that public meeting that that was relayed previously. But I do receive the calls every year in terms of whether or not people want fireworks or whether they want them banned. And it is 50-50. I do believe that the code that was written to think clearly on the discharge of fireworks in relation to fire safety was a compromise that came out of that public meeting. But again, I wasn't here for that, but I do believe that if I'm thinking of the calls that I've received over the past few years, that seems to me like a compromise that's been achieved. And in terms of enforceability, I have lightly reached out every year to the sheriff's office, and you're correct that it is a difficult thing to enforce. By the time a responder has arrived on the scene, often the firework discharge is completed. So it is a difficult issue. It is an emotional issue. On the other side, the calls that we receive are extremely passionate as well, whether it's dogs or PTSD from returning vets. There are many complications to this topic, and I think it's an important one to continue to discuss. Yes, sir.
Go ahead, County Manager.
So based on what I'm hearing on the conversation the board just had, is my suggestion will be for the fire marshal to contact the citizen, let her know that we thank her for her participation on those proposals, and that at this point the board is not interested in taking the next steps on those proposals.
Chair?
Go ahead.
Josh, I think you ought to at least let the citizen, who's obviously very concerned about this, know that we have conflicting issues here with sovereignty. So it's a big deal. Not just here.
Yeah, I think we've touched on a couple of them. We've got the tribal issue. You also, Commissioner Mincer talked about the classification of fireworks. That is done at the state level. There are commercial fireworks, consumer fireworks. We at the county level have only a very narrow scope within the consumer. So there's multiple pieces that are outside of the scope of the county in the first place. And I will relay that to the resident.
I just wanted to add, county manager, not interested is not exactly, I think, the best characterization. I think the board is interested in the issues. We struggle with some of the details of of the effectiveness of the proposed measures. So I don't know, it's a little bit of a semantics, but I just don't want the citizen to think that we're rejecting these out of hand. We continue to think about, ways that we can, find compromises, but we're just not, we're not convinced that these are going to be productive.
Fair enough. Thank you. Thank you, sir.
Yeah. Just.
I'll work on the language with the county manager and we'll get something out to the resident.
Thank you. Okay, any additional comments? Hearing none, we'll move on to our next item. Thank you, Josh. City of Lacey proposed annexation.
Yeah, thank you, commissioners. And I am going to take you back, at least to Commissioner Lancer and Commissioner Edwards. This may be new for Commissioner Mejia. And this proposed annexation was presented to you as a proposal when we had, I believe, the last in-person joint meeting with the Lacey City Council. So attached in your packet is a proposed annexation, and is a citizen initiated annexation. It is around the Lake Louise, on Carpenter and Pacific Avenue. I have included the map with you. As a matter of, as an overview, this includes, let me get right here. There's approximately 95-acre annexation, which includes about 45 acres the city of Lacey already owns and is adjacent to our residential properties. The city-owned land in the annexation includes Lake Louise, which is a habitat preserve, 17 acres, an additional parcel south and Pacific, and as well as includes 18 acres directly to the west and south of Woodland Park. So it includes residential areas and as well as a community center and the senior center included on this proposal. If you see the map, I believe that it's always been considered to be somewhat of a peninsula. I included the signatures, I believe, of the petition, which includes meet the criteria of over 60% of this particular proposal. And through the conversation, I believe Commissioner Edwards, is there any other road project associated with this and how we're going to be managing that? We currently have one project that you may be aware is the safety project on Pacific Avenue. And it will be part of this annexation. And this particular project is on the way to be constructed with a grant by the state, with 100% grant. So there's really no county funds in this. If anything, this will provide a good crossing on Pacific, which benefits the overall community. Also, this proposed annexation will take over portions of Carpenter Road, which right now Carpenter Road is maintained both by the city of Lacey and the county, and that really provides a little more streamline as to how the maintenance of this facility should be conducted. So this has come to the point, I believe, we checked with CPED staff as well as Public Works. There is no significant issues that we can highlight to you, but certainly you're in the position to make a determination. My recommendation is this is, an annexation the City of Lacey Council brought to you maybe a couple of years ago. They're following up with that proposal. There's nothing significant, at least from my point of view, to oppose this annexation or ask for review. And my recommendation is for you to support it.
Questions, Commissioner Edwards?
Yes, I see that this is the 60% you're referring to is through power of attorney. The City of Lacey acquiring power of attorney over these parcel owners for this project. Is that correct?
Yeah, but the owners need to attest to the fact that in fact they're supported.
Yeah, but as a general rule, did this come about by the city providing a service and then the citizen was obligated to sign off on some future activity possibly?
I will not be able to comment on that, whether the citizen was obligated to sign. I can't answer that, Commissioner. The only thing that I can provide is the evidence has provided related to the signatures meeting the 60%. So I really don't have any way to answer that question, sir.
Okay, I guess I would like to see maybe for the map that's laid out, these aren't numbered pages, but the light blue where it shows Lake Lois, and some of that's, surrounded by Lacey, and some of those properties, don't they have quite a few houses on those? But it just doesn't show in that area of blue.
There is some, you're right, there is some already developed residential areas there.
Yeah. I would certainly like to see, maybe through a color coding of a map, probably take a little larger map than this, that these lots have given up their, I guess, right to resistance. I don't know what else to call it, because I know that government sometimes gives folks an option, so that they can move forward in the future. I'm not contesting that. I'm not sure I like it, but I'm not contesting it. But I would like to know where those properties lie in the proposed annexation area. And I would just as soon not rush into this quite as quickly as we did for the golf course. And I think the same thing happened there, where they probably hooked up to water or sewer or something like that. And in the process, they signed off their ability to resist, I guess is the best way I could put it. And so I'd like to know more about this, specifically who is signing off and in agreement and have that color coded on here so we can get some sense. And I'm just going to use kind of a dumb example. It has nothing to do with reality. But on this map, for an example, Kinwood Street has 2 rectangular lots, it looks like, that could be affected. And if I found out that the owners of those lots were adamantly opposed to this, but they fell within the 60%, I'd be more inclined maybe to give them some ability to opt out, because they're going to opt out right up against the county. It seems like, aren't they? Right here?
Right.
This is county over here, right? I just want to give the citizens a voice that maybe they don't feel they have. I don't know. I don't want to cause a big problem, but I don't want to just sign off without those citizens have some voice. And I think, you know, we're their voice. And so we need to be in touch with them, and even though they may have signed off, but maybe not all of them. And I'd like to see where that fits into the 60% versus the 40%.
So that presents a very challenging logistical issue.
Yeah.
Because I don't think we have staff to go out to each individual and attest to the fact whether they'd like to be in or out. That will be extremely difficult for us to meet that request, which we need to respond by the end of the month on this. So I don't know, I understand what you're looking for, Commissioner, but I don't know if I'm going to be able to meet that request, because, you know, this is a request from the City of Lacey where he asks the county to go through a specific survey of each individuals to see if they attest to this annexation or not. And the way that if the board feels strongly about this, then you have the ability to ask for review to the Boundary Review Board. That is the next step if you don't feel comfortable with the proposal. But you know, we can do whatever we can to bring the board to a certain level of comfort to make a decision one way or the other. But getting to the process of reaching out to each of those individuals affected by the annexation to get their perspective, that will be a very difficult logistical challenge for staff to meet.
I don't think that's what I'm asking. I think that there's a list of those that have signed off through their power of attorney. So I'm not quite questioning that. I am questioning those, and I'll just use that example of those properties here that are right next to the county, because I don't want to create peninsulas or islands. And so I just want to make sure. And so if the City of Lacey is coming forward with this proposal, I'd ask them to find out. I'm not saying go back and review all these people that have given up their land right, I guess, by signing off on a power of attorney. That is what it is, and it's probably legal and all that. It doesn't mean I have to like it, but I'll go along with it. So, but there are other properties here, and I'm worried about that 40% group that may not want to be included. But if by them not being included would create an island, I'm not sure I'd support them on that. I'd be more inclined to go along with the City of Lacey's request. But without knowing that, I'm probably going to be opposed to this. So,
okay, so let me see if I may understand what you're looking for.
Okay.
So what you're looking is a map, a parcel map, with, I'm going to use this word, with a dot on those parcels who have signed the power of attorney.
Or a color, yeah, something like that. Yeah, so we can know this whole group over here they're already a done deal.
Yeah. So also the authority the board has on this. You, with all the respect, you do not have the authority to say, okay, move this boundary here. So what the authority you have is to ask the Boundary Review Board for review of this.
Yeah.
So that's the next step. So I don't think the board is in the position to say, let's move the line this, let's move the line.
Oh, okay, well, legally, if that's the case,
So I just want to make sure, so let me work with the staff to see if we can prepare a map where it shows the parcels affected by this annexation, and maybe we can probably color code or some sort of designation for those who have signed on the power of attorney. Is that?
Yeah, I think that would make it easier for me that, hey, obviously the majority over here wants to get out and go with the city, or not, but.
Okay, so.
I'm always worried about, I suppose they signed up for water or sewer, I suppose. I don't know the answer to that. So.
So that's a proposal, Commissioner Mejia, Commissioner Menzer.
Chair Menzer?
As long as we're within the timelines of our response, I don't have any problem with what Commissioner Edwards wants to see. I'm not hearing anything that gives me great concern yet, but whatever questions he has is fine.
Yeah, and I'm in agreement too.
So let me see if we can prepare a map. Will that work?
That'll be great. Okay. Any other questions, comments on this?
On this issue?
Yes, sir.
No, ma'am.
Okay.
I think we've got that.
So our next item is public testimony.
Yes, we have been receiving a lot of in the commissioner's emails, a lot of very pointed emails from the caretaker. I believe is the acquaintance of the caretaker at the Deschutes Falls Park. A lot of very pointed emails with threat of litigation. I was thinking that probably will manage this with Public Works, but doesn't seem to be the case. So next week, I will schedule an executive session with Public Works staff and your attorney to go through the details of this particular matter. I just want to make sure that I acknowledge receiving those emails, and I will probably bring an executive session next week for further consideration and conversation.
I guess more to come.
More to come on that. Okay. Questions, comments? No?
Not on this issue.
Okay. Anything else
On other issues?
on public comments?
Oh, no.
Anything?
I'm good.
Okay. So moving on to other commissioner items. Commissioner Edwards, we'll start with you.
I have a couple things. One of them is pretty simple, but it'll entail some work on somebody's part. On our African American History Proclamation, I had a chance to look that over. And being we're making that proclamation here as a local body, I would like to see some recognition of some of our early pioneers that came here and participated in getting our community going. Just, it doesn't have to be very lengthy, but at least a recognition of those individuals that came here and they couldn't settle in Oregon because of some dumb law they had on the books at the time. I don't know exactly the particulars. And so they chose to come up here where they were very well respected individuals. And I'd just like to have that somehow be included. I'm not here making a suggestion. I'm not looking to write a book. I just thought maybe one of the whereases could make reference to some of those historical folks and their contribution to our community and, Bush Prairie or whatever you want to, however you want to do it. I just think it's an opportunity. I like to do stuff rather than talk about stuff if I have the option. So, okay, that's just, and that's one issue, and then I do have another issue, ma'am.
Okay, and I have an issue with that, Commissioner Menzer.
I have no problem with that suggestion.
Let me work with Nicole and see if we can add some language to this. Thank you.
Okay, and then go ahead, sir.
And I don't know, maybe the county manager made some mention about this maybe last week, but I don't know if it was part of our meeting or going out the door. Where are we at on the mandate for vaccinations and masks and getting back to normal? I am still concerned that the way things are going, what you couldn't even talk about a year ago without being banished from some of these social media sites has now become a fact. A lot of different things, whether the masks work, whether you can even catch the COVID-19 if you get the vaccination, whether you can pass it on to your co-workers and such. And obviously I voted against the mandate, but I'm still an advocate for those individuals that ran up against hard times, if you will, because they chose not to get a vaccination for one reason or another. We don't know why. And I'm wondering when we can maybe get back to, I don't know, recognizing we made a mistake. If we took something away from them, give it back to them, make them whole. Because I'm just afraid we're going to have litigation a few years down the road that's going to be pretty devastating to the county if we can't make everybody whole and get back on our feet sooner rather than later. That's all. And the county manager had mentioned something about this, and that's something maybe he was coming, but I didn't know the time frame on any of that. I haven't had a chance to talk to him. So
What I stated last week was it was in reference to the Supreme Court decision related to striking down President Biden's vaccine mandate, and it was using under the umbrella of OSHA. The resolution in which the majority of the board passed requiring vaccination to county employees and no vaccination weekly testing was prior to President Biden's order and was not under the umbrella of OSHA. And what I stated is we have explored that option in the past, this action, and I believe the board of county commissioners had the legislative authority to implement that vaccine. What I stated is, yes, at some point I need to bring this back to the board for consideration. As you may recall last time, my objective was in June. Whether that is going to be sooner than that, I don't know. And I have been in consultation with Dr. Abdelmalik about this, and considering where we are on this wave and the new variant, that has put me a little bit on the shy point of view to bring this for your consideration. Notwithstanding, the board can bring this item at any time that you would like to discuss, and you can ask me to bring this item at any time for you to affirm, rescind, or change the current resolution. So I'm just giving you my perspective of this, and certainly I work for you, and the board directs me to do anything, I will carry on.
I guess my follow-up to that is just a question. I recognize the Supreme Court said something about OSHA was not able to be the policeman of this whole thing, but didn't the governor use our own labor safety people? Well, what was he passing? What I'm specifically referring to is there was a restaurant down in Maytown that really caught a lot of flack. I don't know exactly what happened on it, but I think they went out of business even. And I thought that the labor and industry folks were the ones that were down imposing financial obligations, I don't know if you call it fines, or against their business license and that type of thing, so that put them out of business. And
well, I don't know if they're, but I think if I recall, if it's the same restaurant that you're talking about, was way before vaccinations. It was when the governor closed all restaurants for open to have the public coming in person. And I believe, if it's the same restaurant.
Yeah, I don't know either.
If it's the same restaurant. So, and they did not obey by that order by the governor, and they kept open the business. So as a result, LNI issue a series of fines. If there's the same example you're talking about, but that was way before the vaccines came part of our lives.
Okay. Well, I'll look forward to that day. Matter of fact, I mean, I'll make that motion as far as getting us back to normal and let, you know, it's unusual that our private schools all remained open the whole time here in Thurston County without any problems. And yet, you know, businesses were closed, schools closed, remote learning, masking, whatever went on. And I just think it's detrimental, and it's time that we need to learn to live with this problem. And if you're in the threat demographic, as I am, you better be more careful. So I'm not an anti-vaxxer or anything. I went and got my vaccination because I think it behooves a better outcome for senior citizens especially, or immunocompromised individuals or people that aren't very healthy. I don't know that if I was a parent of a 10-year-old, I don't know if I'd be too enthused about moving ahead with this because they do have adverse effects from these vaccinations that they've really not figured out yet. I know it's a very minor percentage, but it's probably about the same percentage that actually dies from COVID. I mean, a lot of people die with COVID, very few die because of the COVID. And those that did, they end up with many underlying conditions. So I just think that we continue this unnecessary restrictions of freedoms in our county. And I know I'm the only, I'm not the state legislature, so I don't know what they're doing, but I would very much like to get back to normal. So, and normal might be working from home. And individual employers, if they want to say, hey, wear a mask and get a shot, I just don't want the government doing it to folks. So that's where I'm at. So that would be my move to get back to normal as soon as we possibly can. Thanks, ma'am.
Thank you, sir. Commissioner items, Commissioner Menzer.
Sorry, none, thank you.
And I don't have any as well. Okay, with that, we have reached the end of our agenda setting. So with that, I will adjourn the meeting. Thank you very much. Again, the meeting this afternoon is canceled.
I think the county manager,
Yes, just to say, 20 minutes ahead of schedule.
20 minutes ahead of schedule, yes. Good job, commissioners.
Okay.
County manager, I don't want you to get in the habit of the 9-to-1 agenda settings.
No.
Don't get any ideas about that.
This is unusual because there was a lot of items the board needed to discuss. So I appreciate your flexibility. Thank you.
I don't eat breakfast, so this is a tough one. All right, thank you, everybody.
Thank you. Have a good afternoon.